If you are ready to do that, looks like we are now streaming live on YouTube. Good morning. Welcome to the Joint Standing Committee on Health Coverage Insurance and Financial Services. The committee is assembled electronically this morning for the purposes of inviting public comments on legislation. It's good to be back in front of you actually considering bills and inviting public comments. So we're going to do that this morning via Zoom. Before we get started, I do want to share some background information and nuts and bolts about how this meeting will be conducted using the electronic format. We are being live streamed, as I said, on the YouTube channel for this committee. This means that anyone who is a participant in the meeting via Zoom can be seen and also heard if their microphone is unmuted. So please do be mindful of when your microphone is on or off. People testifying will not be able to be seen or heard until they are called upon to speak by whomever is chairing the meeting. When you are in the queue to speak, you will be pulled into the meeting, so to speak, by our clerk. And it will look briefly as if you are being kicked out of the Zoom meeting. Hang on, don't touch anything on your screen, and you will be brought into the panelist part of the webinar within a few seconds. And then you will be able to turn your camera on and turn your microphone on when it is your turn to speak. And the meeting is being recorded and will be available to view on the committee's YouTube channel soon after the meeting has concluded. Just another note on Zoom, which is that if you are waiting to speak, to testify today, please do go into your Zoom and rename yourself as, for example, Mary Jones, as opposed to iPhone 6 or Dad's computer, because those are very difficult for our clerk to know who you are in order to then call on you when it's your turn to testify. If you click on the three dots on the top right of your Zoom square, you'll be able to rename yourself so that we know who you are in the attendee list and we can call on you. Okay, a couple of other notes would be that if you do need to exit the meeting before you're called upon to testify or have something else come up, you certainly can submit written testimony instead at any time by accessing the legislature's testimony submission page at www.mainelegislature.org. We are going to use a 3-minute timer today, I think, although I think we've got very short hearings today, so we're probably not using the timer today. We are starting with some quick and easy public hearings to work out the kinks because we are in uncharted territory to a certain extent here on Zoom. You may see members' children, dogs, house phones, and other things briefly interrupt us from time to time. We ask for your patience and that you bear with us as we're navigating this brave new world while keeping each other safe and apart. All questions, all persons testifying are going to be announced through the chair. As I said, we'll be pulling you into the meeting. As we've done this in person, if you're testifying for the bill, you'll be called first. Those against the bill will be called second. Those neither for nor against the bill will be called in the last group of those wishing to provide testimony. And please do ensure that when you are speaking, you are not on mute so that we don't have to say over and over again that you're on mute. And so with all of that prefatory material done, I think at this point we will go around and have our committee introduce themselves. So let's start at this point with Representative Evans. Go ahead.
Good morning, everyone. I am Representative Richard Evans. I represent District 120, including Atkinson, Dover Foxcroft, Medford, Milo, Plantation Lakeview, Orneville Township. Thank you.
Thank you, Representative Evans. Representative Arford.
Thank you so much, Madam Chair. I am Representative Poppy Arford, and I represent State House District 49, which is the western half of Brunswick.
Thank you. Representative Quint. Representative Quint, you're still on mute.
Okay, can you hear me now? Okay, thank you. I represent House District 144. That's Holton, Hodgson, Amity, Cary, Weston, Selden, Haynesville, Molunkus, and Silver Ridge Township.
Well done. All right, Representative Connor.
Good morning. Thank you, Madam Chair. My name is Representative John Connor. I represent part of Lewiston in District 58. Thank you.
Representative Brooks. You're on mute.
Sorry about that. My name is Heidi Brooks. I represent House District 61, which is part of Lewiston.
Thanks, Representative Brooks. Representative Blyer.
Thank you, Madam Chair. My name is Representative Mark Blyer. I represent District 22, which is Leamington and part of Buxton, Standish, and Limerick.
Representative Matheson.
Thank you, Madam Chair. My name is Christy Matheson. I represent Kittery, District 1. Thanks so much.
Thanks. Representative Melrano.
Thank you. Good morning, everyone. My name is Gina Melrano. I represent House District 62, which is part of Auburn.
Thanks. Representative Morris.
Good morning. I'm Representative Joshua Morris. I represent House District 75, which is Turner, Leeds, and part of Livermore.
Thanks. Senator Brenner.
Thank you, Madam Chair. My name is Stacy Brenner, and I am the senator representing Senate District 30, which is all of Gorham, most of Scarborough, and part of Buxton. Thank you.
Thanks. Senator Stewart.
Good morning. Thank you, Madam Chair. I'm Trey Stewart, State Senator for District 2, which is Southern Aroostook and Northern Penobscot counties.
Great. And Representative Tepler. I don't think I skipped anyone, but please let me know if I did. Representative Tepler, you're next.
Thank you so much, Madam Chair, and good morning, everyone. I think I'll be taking over the committee at this point. I'm Denise Tepler. I'm the House co-chair of the committee, and I represent House District number 54, which is all of the town of Topsham. And with that, I'd also like to introduce our our clerk, Christian Ricci, and our wonderful analyst, Colleen McCarthy-Reed. They'll be with us this morning and will have some responsibilities to help us through the hearing. So I'm also going to ask my committee members to please use the hand raise function if you have a question to ask of someone who's testifying, and I will call on you. So with that, I'd like to open a public hearing on LD5, sponsored by our very own Senator Sanborn. Senator Sanborn, please kick off our public hearings.
Thank you, Representative Tepler. All right. Representative Tepler and honorable members of the Committee on Health Coverage, Insurance, and Financial Services, as you know, and Senator Heather Sanborn representing Senate District 28, including Westbrook and part of Portland. I suppose it's good that I said that in my testimony because I don't think I introduced myself this morning. I am proud to introduce LD5, an act concerning the reporting of healthcare information to the Emergency Medical Services Board on behalf of the Maine Department of Public Safety and the Maine Emergency Medical Services, which is Maine EMS. This legislation was voted out of this committee unanimously as ought to pass as amended in the 129th legislature. However, due to the COVID-19 pandemic, the bill was not heard on the floor. During the last session, Maine EMS, Maine DHHS, the Maine Ambulance Association, Health InfoNet, and the Maine Hospital Association worked collaboratively to put forward a bill that met the needs of our first responders. As the summary describes, this bill is intended to amend the laws regarding reporting of healthcare information to Maine EMS and the Board of EMS. It allows the board to request and collect and receive healthcare information and records from hospitals and physicians following routine and technical rulemaking that involves all of the stakeholder organizations. The purpose of this legislation is to allow Maine EMS to better understand healthcare outcomes after they deliver their patients to the receiving healthcare facility. Building out this capacity will dramatically increase our providers' abilities to improve the continuum of care for all residents of and visitors to the state of Maine who interact with the EMS system. It also underscores Maine's healthcare system's charge to grow and empower continuous quality improvement programs. While this bill allows for the Board of EMS to specifically request records, it also allows healthcare systems to submit those records electronically and automatically by enabling Maine EMS to have access to the existing Health InfoNet. As always, this bill maintains that all of the reportable healthcare information obtained through this provision remains confidential, especially that information that is personally identifiable. Mr. Hurley, the director of Maine EMS, is present at today's hearing and plans to testify on behalf of this bill as well. And he will probably be the better person to direct your questions to, should you have questions about this proposed legislation. Thanks for allowing me to reintroduce this bill this morning, and I look forward to working with all of you on it.
Thank you, Senator Sanborn, and I apologize. I was so anxious to get started, I forgot to let you introduce yourself, but fortunately you were able to introduce yourself in this introductory piece of testimony. So are there any questions from the committee for Senator Sanborn? Seeing none, I think we will move on to supporters of the bill. And I will call Sam Hurley into the committee to testify.
Mr. Hurley is not yet on the call.
Ooh. Okay, well then I guess while we're waiting for Mr. Hurley, we will hear.
I believe he is.
Mr. Hurley
is
is there.
Jonathan Hurley, if you look at the name.
Oh.
Thank you, I'm sorry. And I'm glad he is here. Welcome, Mr. Hurley. Thank you for being here, and please go ahead.
Good morning. Thank you. Senator Sanborn, Representative Tepler, and honorable members of the Committee on Health Coverage, Insurance, and Financial Services. My name is Sam Hurley, and I'm the Director of Maine Emergency Medical Services, or Maine EMS, within the Department of Public Safety. I am testifying on behalf of LD5, an act concerning the reporting of healthcare information to the Emergency Medical Services Board on behalf of the Maine Department of Public Safety and Maine EMS. This bill is intended to enable Maine EMS to obtain healthcare information and records from hospitals and physicians regarding patients that are treated by EMS professionals' ability to improve the continuum of care for patients who interact with one or more of the 5,600 EMS clinicians across the state of Maine. Maine EMS, the EMS board, and EMS agencies across the state are dedicated to continuous quality improvement and providing the highest quality of care possible to people that they serve daily. This data will enable the EMS board and services to better understand the impacts of their treatments and the quality of care that is being provided. While this bill enables access to patient care records, the initial focus is obtaining outcomes data from patients who have interacted with the EMS system. It was written to be forward-thinking insofar that one day a main EMS clinician could potentially import a patient's medication history, past medical history, and allergies into their patient care report by entering appropriate identifying information, just like is done at a hospital. Passing this legislation will allow our state to join a cadre of states throughout the country who are participating in ongoing quality improvement projects surrounding time-sensitive conditions. Specifically, Maine EMS hopes to use this invaluable legislation to participate in the cardiac arrest registry to enhance survival, or CARES program. Joining this ongoing national program with 28 other states will enable Maine EMS agencies to benchmark themselves nationally, better understand trends in clinical care, and most importantly, provide feedback to our clinicians. As a paramedic myself, I have worked in a jurisdiction that participated in the CARES program. It allowed clinicians to get crucial feedback regarding their clinical care in the field and better associate clinical performance with improved outcomes. Reinforcement among our clinicians is paramount to maintaining quality and reinforcing high quality clinical care in the field. Additionally, access to data referenced in this legislation will also enable Maine EMS to better understand the continuum of care for other conditions, including strokes, heart attacks, and trauma. Imagine the value of being able to understand whether EMS clinicians in the state are readily identifying stroke patients in the field accurately. Currently, Maine EMS has no capacity to do so with the current data set because it only gives us a momentary snapshot of the patient while they are being treated by the EMS professional. Access to the data described in this legislation will allow the EMS board and Maine EMS to analyze outcome information from patients treated by all EMS clinicians, thereby dramatically increasing the power and efficacy of our state's existing quality assurance programs. As written, this legislation allows for healthcare facilities and physicians to submit those records electronically and automatically to the EMS board, being their existing relationships with Health InfoNet. This means that there will be no increased burden on any of the associated parties regarding data sharing. This legislation is required to enable the Maine EMS board to have access to that data via the HIN system. This bill maintains that all reportable information obtained through this provision remains confidential, especially that information that is personally identifiable. This legislation alone will not enable providers to do random searches. In the 129th legislature, this version of the bill was passed out of the committee as ought to pass as amended. However, due to the COVID-19 pandemic, it was not heard on the floor of the legislature. During the last session, Maine EMS worked collaboratively with a variety of stakeholders, including the Maine Hospital Association and the Maine Ambulance Association, to refine this legislation and address all of the concerns that were raised. It is our utmost priority that we are using this information we have available to improve care to the greatest extent possible. Maine EMS appreciates your time and attention to this matter, and we hope that you will support this legislation to enable EMS clinicians to continue improving the quality of their care that they provide to the residents of and visitors to the state of Maine. And I am more than happy to answer any questions you may have regarding this proposed legislation. Thank you.
Thank you very much, Mr. Hurley. We appreciate your testimony, and I'm looking to see if there are any questions from the committee for you. I see that Representative Evans has a question for you. Please go ahead, Representative Evans.
Thank you, Madam Chair. Mr. Hurley, I just wanted to say I perfectly understand the rationale for access to the information that's going to improve the quality of care and how EMS in particular responds to a given situation over time. So you're collecting that data. Any other data, I just have a concern, not necessarily a concern, but I'm sure I would be guessing, but I'm probably sure that any other data is going to be just raw data that will not be publicly accessible in any fashion.
So thank you so much, Representative Evans. So none of the data will be publicly available. It will all be behind our high tech. It's called high tech because it's compliant with the most current HIPAA guidelines. So it will all be behind a firewall. But we will only really be receiving outcomes-based data. So we won't receive, well, they received this antibiotic in the hospital or they received that medication in the hospital. We will be receiving the ICD-10 codes for discharge outcome level data. So it won't be the granular level data of what they received in the hospital.
Thank you. And do you have a follow-up, Representative Evans?
No, thank you. He answered my question.
Great, thank you. And so I see Representative Connor has his hand up. Please go ahead, Representative Connor.
Thank you, Madam Chair, and thank you for that testimony, Mr. Evans. My quick question that I have is, you had mentioned the IT, the high-tech IT. Is that a infrastructure on the EMS's end? They're just pulling data from the main, the healthcare providers, and then they're storing that data on their own. And so my main question is, who is going to be responsible for maintaining that infrastructure, that IT infrastructure? Is that the healthcare providers? Is that the EMS agencies themselves?
Thank you, Representative Connor. That's an excellent question. So Maine EMS, on behalf of all EMS agencies throughout the state, provides the electronic patient charting infrastructure for every EMS agency in the state of Maine. So that is actually funded for, maintained, and supported by my office directly. So that infrastructure is all compliant with all of the most up-to-date compliance standards as defined by CMS and Health and Human Services. So it wouldn't be an added onus onto the agency to do any additional work to maintain that. That would all be maintained by my organization.
Thank you, Mr. Hurley. Are you all set, Representative Connor, or do you have a follow-up?
No, Madam Chair, I'm good. Thank you very much.
Thank you. And Senator Brenner, please proceed.
Good morning, Mr. Hurley. Thank you so much. I'm excited about this bill because I do think that it is exactly what we were hoping would happen when we made medical records electronic, that they could be used for this kind of purpose. My question for you is, are there a handful of specific things that you can point to that you're anticipating looking at measures for? Like, are you looking for responses to heart attack or stroke or diabetic coma? Like, what are the sort of top 5 things that you're looking for data about?
Thank you for the question, Senator Brenner. That's an excellent point. So as I mentioned in my testimony, we are particularly interested in cardiac arrest data, learning whether or not our interventions resulted in improved outcomes following discharge for patients who suffer from an out-of-hospital cardiac arrest event. And so that's going to be one of our top priorities, is joining the CARES registry, which is a national consortium of over 28 states to benchmark ourselves. Additionally, we intend on looking at stroke outcome data to determine whether our stroke screening tools that we use on a daily basis are working effectively and that our EMS clinicians are using those tools effectively. For instance, if we have patients that's transported by 911 and the chart indicates that they didn't identify a stroke, however, the discharge code reflects that the individual suffered from a stroke as a result of their, suffer from a stroke, then we can compare that information and say, okay, well, what do we need to provide feedback back to that EMS clinician? Is there remedial training? Is there feedback that we need to give to them to improve the quality of care that's being delivered on a daily basis? And that's a gap that we have now. We basically see the chart for the moment in time that we interact with the patient, and that's the end of it. And luckily, most hospitals have tried to have just conversations with quality assurance programs locally, but we need a way to track that globally, and we need a way to make sure that everyone is offered those same benefits. In addition to that, there are heart attack outcomes that we would like to measure regarding when someone got to the cath lab, their time to catheterization, and so stroke, heart attack, cardiac arrest, and then sepsis. So we understand that sepsis is one of the major killers of patients in the hospital, and for patients in general, persons who have a systemic infection. And so early identification of septic patients is really critical. And EMS wants to really play a key role in that. So sepsis will be another measure that we will be focusing on as part of this information. Off the top of my head, I don't want to grab at straws for the fifth one, but there are certainly an endless supply of opportunities where we can intervene to help improve the access and quality of care that we provide in the field. And even if it's just like appendicitis, if we were able to more early and readily identify appendicitis, we could take a patient from, instead of taking them to a local rural hospital that has limited surgical capabilities, we could take them to a more appropriate facility rather than have to take them and then have them transferred later. So it's just all of these things coming in together to get the patient to the right care at the right time. So it's all of those factors that are a confluence with this bill.
Thank you. And moving on, Representative Arford has a question for you, Mr. Hurley.
Yes, thank you very, very much, Madam Chair. And thank you, Mr. Hurley, for coming before us. I just want to make sure I understand what the data stream is that you are going to be accessing through this bill. And am I correct in understanding you're going to be accessing the Health InfoNet data stream? And then is there another data stream that you are going to be accessing through this bill?
So our primary data stream will be through Health InfoNet because all of the state's emergency departments participate in Health InfoNet. We did build in a component where they can work collaboratively with physicians to receive data as needed. Specifically, we have community paramedicine programs within EMS where we go out into the community on a non-emergent basis to help assist patients. And so we want to make sure that using this bill, those community paramedicine programs can also get access to those records, which most of those have access now through the collaborative agreements that they have in place with the physicians. But our primary stream will be through Health InfoNet. But we, yes, ma'am.
Excuse me, I interrupted you. I apologize. I'm still getting used to the Zoom back and forth myself. So no, please finish.
And so that was done collaboratively with the Maine Medical Association, yes, last year. So we worked collaboratively with them to define what that pathway would look like. And we intend on including them when we go into rulemaking about the specific matter. But our primary mode of information gathering will be through Health InfoNet.
And so you will be downloading your data into Health InfoNet as well as taking data out?
We actually already submit our data to Health InfoNet in almost a real-time basis. So within 30 minutes following the completion of a run or a transport, all of Maine EMS's data is exported to Health InfoNet. But the problem is we don't get anything back. It's a one-way street right now.
And so just two more quick questions. I'm somewhat familiar with Health InfoNet because I served as a patient representative with them in the very beginning when they were getting started about 10 years or so ago. And how is it, I'm just curious, how has it evolved that you were left out prior to this? Because, you know, in listening to you, you make a very good case for being part of, you know, accessing the information, using it for very good purposes to improve the quality of care. So can you just quickly, briefly comment on that, the evolution of how you have not been part of that before, prior to this?
Thank you, Representative. I will be candid and say that I have been here for 15 months and the evolution of Health InfoNet was prior to my arrival. So I don't want to speak to the evolution of Health InfoNet and how that came about. But we have been participating as far as sending the data to the system, just not receiving it. And so I'm not exactly sure how we ended up not being able to receive data, but we have been participating as far as sending our data, which is important. Because hospitals need to readily have access to the data that we send them. But I cannot speak to how we got to this point. I'm sorry.
I'd be very interested in having some understanding of that going forward. And then the last thing is, it's my understanding that patients can opt out of Health InfoNet. At least they used to be able. Is that still the case?
To my knowledge, yes, ma'am. They can opt out of Health InfoNet.
Okay, great. Thank you so much.
Any other questions from the committee for Mr. Hurley? Thank you for your testimony, Mr. Hurley. I see no further questions from the committee. And I'm wondering if there's anyone else in the participant list, in the attendee list, who intends to testify in support of the bill. Again, seeing none, is there any testimony against the bill? Nope. Seeing no testimony against the bill, I see that there are two people signed up to testify neither for nor against. Rebecca Graham from the Maine Municipal Association and Dan Morin from the Maine Medical Association. If they can join the panel now, we'll take them in the order they're signed up.
Ms. Graham is not on the call, but Dan is joining now.
Okay, so Mr. Morin, welcome, and please present your testimony neither for nor against to the committee.
Thank you, Representative Tepler. Honorable Heather Sanborn and members of the Joint Standing Committee on Health Coverage, Insurance, and Financial Services. I'm Dan Morin, Director of Communications and Government Affairs for the Maine Medical Association. Our testimony is neither for nor against. You should have it in front of you on your screen. We represent more than 4,300 physicians, residents, and medical students. Mission to support Maine physicians, advance the quality of medicine, and promote the health of all Maine residents. I won't go over what the bill says. The bill does include a specific reference to physicians and hospitals satisfying the board's request for healthcare information by authorizing the board to retrieve that hospital or physician's data from the Health Information Exchange. But not all physician practices participate in such an exchange. And we therefore are concerned with the costs and administrative burden that may be placed on the smaller independent practices. So it was no surprise to us that that physicians consistently choose paperwork and administrative burdens as their top issue of concern in medicine. That's especially true with independent practices. Those are the practices that aren't affiliated with hospitals or hospital systems. They don't employ a large back office support staff, and it's a group of physicians to which we've become much more familiar with during the pandemic, as some of you may have seen through media. A vast majority of those smaller practices do not submit data to Health InfoNet. We're not talking about the Intermeds, the Martins Points, or the Spectrums. I believe at least Intermed and Spectrum do, but we're talking about the smaller practices. So one of the issues that you've talked about in your committee over the past years, and some of the new members won't necessarily be familiar with, but may hear about it, is prior authorization. And although it's a separate issue from the bill before you, it's certainly a familiar topic. And a survey a few years ago on prior authorization by the AMA showed that practices deal with 31 prior authorizations a week on average, and the accompanying workload for staff is about 15 hours of work, nearly 2 business days of physician staff and time. And they even have staff that work exclusively on prior authorization. So the coronavirus pandemic has really hit smaller independent physician practices hard. Challenges that no one knew existed now are facing these smaller practices. They have to adapt, reimagine how and where they deliver care. The speed at which it's occurred has had a profound impact on them. The business impact has been severe. The loss of revenue through the cancellation of routine appointments and even necessary care has really reduced the revenue. And now they're just trying to catch up. And a lot of practices are still only back up to about 60 or 70% of their previous revenue because of declining appointment volumes. Another example I'll use of administrative burdens that are now coming up on these practices is we're in the process of getting more than 1 million shots in the arms of Mainers over the next handful of months. It's going to be messy, but it's going to be an attainable goal. And DHHS's goal right now is to get as many doses into the arms of—
Warren, excuse me.
Yeah?
I'd like to know whether this testimony is directly addressing LD5, which is EMS bill.
It is, because I'm going over the administrative burden, and what I'm asking for, if I could finish this segment, is an exception in the bill for smaller independent physician practices who don't submit data to Health InfoNet. And the fact that there's going to be a massive increased administrative burden on physician practices as a result of just the vaccination efforts on COVID-19, we think warrants the exception in this particular bill, while all the while supporting the quality improvement efforts that EMS is trying for.
Okay. Is that the end of your testimony, Mr. Moran?
It wasn't. I can continue if you want, or take some questions, but I think the committee's got the gist, but I was hoping to complete what I was talking about, the administrative burden, so the committee can get enough information to appropriately consider whether an exception is warranted or not.
Okay, please continue then.
So we're trying to get 1 million shots into arms, and one of the things that is under the radar that not a lot of members of the public will know is that a lot of 70-plus-year-old patients, for example, or patients with high-risk conditions, will go through these vaccination clinics. And then when the vaccine does spread out into smaller practices, every small practice is going to have to go through every patient in the state's database on vaccines to figure out which one of their patients has had the vaccine, who needs a second vaccine, which type, and when. So the staff are small in these back offices, and that added component of an already overburdened staff for administrative processes will really put a hindrance on their ability to achieve their goal of seeing their own patients. So there's no magic solution for eliminating the paperwork and those administrative burdens, but you can help ease those burdens by providing an exception, as I previously indicated, for the smaller independent practices or practices who are not part of the Health InfoNet system. We've determined that there are over 600 independent physicians outside of hospital systems, and those don't include the larger independents like Martins Point, Intermed, and Spectrum. And there are a couple of Lewiston members on the committee. Pediatric Associates is a great example. It's one of the, if not the largest pediatric practices in the state. I don't believe they participate in Health InfoNet. I'll find out, but that's an indication of one of those practices that just can't authorize that you pull it from Health InfoNet. So for those reasons, we hope that you can make that exemption, and we're neither for nor against, because we think it's a great goal. We just want to make sure that the smaller physician practices aren't overburdened by the request.
I guess I am confused, Mr. Moran, about how exactly the burden to the smaller physician practices is created by the accessing of InfoNet data by the EMS.
The bill says,
explicit about that?
The bill says that hospitals and physician practices can, instead of providing the data directly to EMS, they can give authorization for Health InfoNet to provide the information that those entities already provide Health InfoNet. What I'm telling you is that smaller independent practices do not participate in Health InfoNet. And there's another section in the bill that says if you don't participate in Health InfoNet, you have to aggregate the data yourself and send it yourself to EMS. So it's an added administrative burden because those practices are not sending information to Health InfoNet. They're going to have to go into their own records and provide it on request, and it'll just add another point of workload for the back office staff.
But it's only by request from EMS, not for every single case that EMS deals with?
Exactly. So we don't know we don't know how often that's going to happen, and it says shall. If EMS goes to doctor practice A, they have to do it. They don't have an option.
Thank you, Mr. Moran. I see we have several members of the committee with questions as well. Senator Brenner, please proceed.
Thank you, Madam Chair. Mr. Moran, could you give me a sense of what your anticipated number of requests from EMS would be to these small practices, given the nature of EMS's work and the engagement with these smaller practices?
That we don't know. And that's part of the question. So we don't know how much of a burden it will be. I mean, there are rules to be made. And we just think that mandating that these practices do it without knowing the specifics ahead of time could be a problem.
I think that correct me if I'm wrong, but I think the intent is to understand what happens when you deliver a patient for direct patient care at a hospital, at an inpatient facility. Correct?
I'm not sure about that myself. So wouldn't it include, not all, yeah,
EMS isn't getting called to deliver a patient to a primary care provider.
No, but they're asking for records to see whether what they did during that transportation or stabilization had, what the outcomes were long-term for those patients, if what I'm understanding is correct. It's not to find out what they not only to find out what they necessarily did during that point of contact in that acute situation, it's to find out what happened after also.
Okay. Thank you.
Thanks.
Madam Chair, I think you're muted.
Thank you, Senator Brenner. I got confused there for a second. Senator Stewart, did you still have a question?
Well, thank you, Madam Chair. It was very similar to Senator Brenner's question, where I'm wondering, I guess, what the propensity is of that exact scenario to actually play out. And so I'm hoping that maybe for the work session, whoever would be able to provide some more context about the amount of cases that we would actually be talking about, where there would be a small practice, I suspect probably in rural parts of the state, if any, that may be the treating physician once somebody is getting a ride there through EMS, if that makes sense.
I think it does make sense, Senator Stewart, and I would also like to add that I'd like data on the number of times that small rural practices call EMS to transport patients, which I guess would be the other scenario where this would play out. And I think we just need data to understand some of the problem that Mr. Moran is describing and whether it's de minimis or more. So are there any other questions from the committee for Mr. Moran? I'm seeing, oh yes, Representative Arford, please go ahead.
Thank you very much, Madam Chair, and thank you very much, Mr. Moran, for coming before us and testifying. I think you make an excellent point, and my question, I'm glad that we're going to be exploring it further. And my question to you is simply, industry standard. Health Infonet has been with us for probably, at least 10 years. And part of its reason for being was simply to do what EMS wants to do with the data. It's to allow physicians to follow their patients as they travel from in and out of different healthcare systems within our state and to deliver better care, but it's also for analytical purposes. So the standard of use, I would ask, within the healthcare industry here in Maine, the other organizations that are doing the same type of analytics that EMS would like to do, generally, are they limited to accessing the Health InfoNet data, or are they also getting this other data stream that you're talking to us about, which is coming from smaller practices that are not currently participating in Health InfoNet?
You had me right until those last two lines. That I picked industry standard view. It's been around for years. Analytical services. So
right. What I'm saying is that there's a number of I'm assuming that all the large healthcare organizations in our state are using their Health InfoNet data to do some sort of assessments as to the quality of outcomes, which is what EMS is asking us for, the ability to do the same thing.
Yeah.
So what I'm saying is, with these, you may not know the answer to this question, which is fine, but if you know, and if you do know the answer, with these other organizations that are also using Health InfoNet data to run analytics assessments of outcomes to improve the quality of the care that they deliver, are they accessing this the data from the small or the other practices that simply don't participate in Health InfoNet? Are those practices now being asked to provide data to other entities for the purposes of evaluation and assessment?
I know exactly. Yeah, I get your question. And I don't know the answer to that, but I can certainly ask for sure if they have any other requests from MHDO or whatever it may be. That's a great point. Thank you. I can check on that.
Thank you.
Thank you, Rep. Arford. And are there any other questions for Mr. Moran? Oh, seeing none, I believe Rebecca Graham has rejoined us. Has she? No. Okay. Ms. Graham, if you can hear this, I'm sorry we lost you. I don't know what the problem is, but whether it's on your end or ours, but we would welcome more written testimony if that is an issue. So I apologize, but I think we're going to close the hearing on LD5 unless Ms. Graham shows up within a second or two here. And yes, I think we'll just move on now to our next public hearing. Oh, I'm sorry, Dr. Evans, did you want to ask one more question regarding this issue?
Yeah, I think for clarification, what Mr. Moran was talking about is under Section 96, Item 1B. It says a physician shall report to the board healthcare information or records requested by the board, including information or records that identify or permit identification of any patient concerning an individual under or formerly under the physician's care who received emergency medical treatment. That in itself says a lot, because it depends on how long ago that patient may have been seen in that practice, in a small practice. So that individual may or may not have any current information. I think the problem is the streaming as far as connectability. A lot of the small practices do not participate in Health InfoNet. And I think the request that he's making is a legitimate request, but we have we do have a need to find out more directly. I'm going to venture to believe that most people practicing in small practices are not participants of Health InfoNet. On the other hand, now, if you are associated with a larger hospital or larger system, you may have access through that system. So if we can clarify that, I think that would answer the question and the concerns that he has. Because most of the small practices are related to a medical facility in some form or fashion. Say, for example, I'm a general surgeon. I am in independent practice. I have a private practice, but I do my surgeries at Mayo Hospital. So there's a connection there. So there's a possibility of having that information delivered through that type of a system. But like you said, I think we need to have more clarification before we move forward. Otherwise, I have no problems with the bill as it is otherwise. But I think just for completeness sake, if we can clarify that particular point. Thank you.
Okay, thank you. So what I hear you saying, Representative Evans, is that you would like to get that data that we were talking about for the work session because you feel that it's important for us to understand the degree to which the problem Mr. Moran described is actually an issue.
Yes, thank you.
Thank you. All right, so again, is there anyone else with comment? Well, actually, we don't usually do comment so much at this point, but just questions that or data that they need for the work session? Okay, I think Representative Brenner has one more question she would like to ask for the work session.
I would like more information about what the barrier to engagement with Health InfoNet would be for a smaller practice. Is it financial? Is it time-based? Is it work? Is it talent to produce the information, put the information into the system? So I guess a deeper, just, you know, like some kind of one-page explanation of what that process is, because I think it would help clarify for me what the barrier is for those smaller practices.
I think that's a good question, Senator Brenner. I think that, you know, it may not specifically relate to the barriers in this bill, but it certainly generally relates to it. And it is a concern that we have as we're trying to get everyone on board with the electronic medical record system so that information can be shared around the state. So yes, I agree. It would be helpful to have some information about the barriers for small practices to joining Maine InfoNet. Thank you. Okay, now I do think we may be done with this public hearing. And I would like to move on to the public hearing on LD6. And that is again, Senator Sanborn's to present to us. So I'm opening the hearing on LD6, and Senator Sanborn, please present your introduction to the bill.
Thank you, Madam Chair. Members of the committee, I'm going to go double check that I'm off mute. Yeah, okay, good. So I am here to present LD6, which is proposed by the Department of Professional and Financial Regulation in the Bureau of Insurance. The major section of this bill addresses new federal and international requirements for reinsurance, which is a process for insurers to spread risk amongst one another. Specifically, it brings Maine into compliance with new international agreements that exempt some of the largest and financially strongest reinsurers based in the United States and in Europe from requirements to post collateral in order to do business with the other country's insurance companies. The bill also proposes a variety of other technical updates and corrections to the financial provisions of the insurance code. This was a bill that we worked on and passed unanimously out of our committee last session, and that is reappearing again here due to not making it to the floor prior to the COVID-19 shutdown. Superintendent Chapa is here and will explain this all in more detail, and I certainly encourage you to defer your questions to him. Because I don't want to answer questions about reinsurance that I know nothing about. So with that, I will turn it back over to you, Madam Chair.
Thank you very much, Senator Sanborn. And so I won't ask the committee if they have any questions about the bill for you. And we'll move on to testimony in support of the bill. And I believe that at the top of the list for testimony in support of the bill is Bruce Garrity from the American Property Casualty Insurance Association. Please join us in the panel, Mr. Garrity.
Can you hear me now, Representative?
I can hear you, and now I can see you as well. Welcome, Mr. Garrity.
Thank you. Senator Sanborn, Representative Tepler, and members of the committee. My name is Bruce Garrity. I'm here on behalf of APCIA, the American Property Casualty Insurance Association. My testimony will be very brief, Representative. We do support this legislation. Reinsurance standards are crucial to the effective operation of the insurance industry. As many of you may understand, not only do businesses reinsure some of their exposures, insurance companies reinsure some of their exposures. And if we don't have appropriate standards in place, that can create serious problems. For example, we were fortunate after 9/11 that regulators were able to demonstrate to several reinsurers the importance of them participating in the costs associated with that tragedy. So we are supportive of this, and I think the superintendent's testimony speaks for itself, and I'd be happy to try and answer any questions the committee might have. Thank you.
Thank you very much, Mr. Garrity. And I'm wondering if perhaps questions for you should wait until after the superintendent presents his testimony, and if you hang around in the panel for that time so we can address those questions after the superintendent presents his testimony. So I'll ask Christian to please leave you in the panel, and if you would just hang around and mute yourself until questions are asked of you. That would be great.
Representative, I'm always happy to hang around with the committee and happy to do that.
Yes, and even now you're in the front row.
In the third seat.
Yes, thank you. Well, right now you're actually in the far right-hand corner in my screen, but maybe you're in the third seat in someone's screen. So I'm going to ask the superintendent, Eric Chapa, to please join us in the panel and present his testimony in support of the bill.
Good morning. Can you hear me?
Yes, sir.
Thank you. Senator Sanborn, Representative Tepler, and members of the committee. I am the Superintendent of Insurance, Eric Chapa, and I'm here today to testify in support of LD6. First of all, I'd like to thank Senator Sanborn for agreeing to sponsor this bill. We very much appreciate it. With a minor change to add a technical correction, LD6 is identical to the same bill that 129th passed without amendment unanimously, but as Senator Sanborn said, unfortunately, it never got out of the legislature due to COVID-19. The major provision in this bill would revise Maine's reinsurance law to conform to new federal requirements imposed by an executive agreement between the United States and the European Union. Reinsurance is insurance for an insurance company. A strong worldwide insurance market allows global risk spreading supported by global capital pools. This means, for example, that insurers providing coverage for Gulf and Atlantic hurricanes and California wildfires are backed in part by resources from countries such as Britain, Germany, Switzerland, and Japan. This makes insurance much more stable, benefiting everyone as long as those worldwide markets are effectively regulated. In 2013, based on model legislation developed by the National Association of Insurance Commissioners, Maine authorized large, financially strong reinsurers with effective regulatory oversight to do business as certified reinsurers, which allow them to reduce collateral they post in the United States. And just a brief word on the NAIC. When I'm speaking today about, I'll mention the NAIC several times, and over the course of the session, probably I'm likely to do as well. The NAIC is a member-driven organization. The decisions made are made by the members, and specifically on this bill, Maine is an active member of the Reinsurance Task Force, and I'm going to talk about the Qualified Jurisdiction Task Force. Maine is actually the chair of that group. General Counsel is the chair. So when I talk about the NEIC, it's very important. These are decisions that are made by members, which are the insurance commissioners of every state in the country. In 2017, the US-EU bilateral agreement mandated that states of the United States and member nations of the European Union take further measures to open their insurance and reinsurance markets, including mutual recognition of the home country's regulatory system for multinational insurance group and the complete elimination of reinsurance collateral for reinsurers, meeting the requirements comparable to those that the NEIC has established for certified reinsurers. A similar agreement was recently concluded with the UK, effective upon Great Britain's departure from the EU. Under the Dodd-Frank Act, the Treasury Department's Federal Insurance Office, or commonly known as FIO, has the power to preempt state insurance laws that are inconsistent with these agreements. And the agreements require FIO to begin this preemption process this year. It is important to note that when it negotiated these agreements, the federal government worked from standards developed by state insurance regulators rather than requiring states to abandon the existing framework and start over with something fundamentally different. In 2019, the NAIC adopted amendments to the Credit for Reinsurance Model Act to implement these international agreements and to provide a level playing field for reinsurers in other countries by providing a pathway for those countries to be recognized as reciprocal jurisdictions under conditions similar to those already established for the EU and the United Kingdom. The NAIC has completed its review of the countries currently designated as qualified jurisdictions under the existing law and has recommended that the designation of Bermuda, Japan, Switzerland as additional reciprocal jurisdictions. And again, Maine is the chair of this group. This bill would codify the 2019 amendments to the NAIC model into the Maine Insurance Code. The NAIC is in the process of adopting these amendments as a new accreditation standards, which states will be required to adopt in order for the insurance bureaus to maintain the accredited status. In addition, this bill would adopt the recent NAIC model guidance for reciprocal recognition on stays issued in insolvency proceedings. It would make a number of technical changes to modernize obsolete financial regulatory provisions of the insurance code and to correct various areas and inconsistencies in the provisions that have been identified. Thank you. I'd be glad to answer any questions now or at the work session.
Thank you very much, Superintendent. Are there any questions from the committee for either Mr. Garrity or Superintendent Chapa? This is a fairly complex technical issue, but of course you can always have questions answered at the work session if you need them answered there, but this is a good time if you need more information to request it from either of the folks who are with us right now. Seeing none, thank you very much, Superintendent and Mr. Garrity, for your testimony. And next up, we'll have Mr. Charles Sultan and Catherine Pelletreau. Mr. Sultan represents the Maine Association of Insurance Companies, and Catherine Pelletreau represents the Maine Association of Health Plans, and they both are testifying in support of the bill. So welcome, and Mr. Sultan, please go ahead.
Thank you, Representative Tepler, members, Senator Sanborn, members of the committee. I am Charlie Sultan on behalf of the Maine Association of Insurance Companies. The MAIC, as we call it in shorthand, are your Maine-based domestic property casualty carriers. So we write a large portion of the homeowners and auto insurance for Maine residents, as well as commercial activities. Another member is Medical Mutual Insurance Company of Maine, which writes the large bulk of professional physician liability insurance in the state. So we are your local sort of outlet for insurance in the P&C world. And it's a pleasure to see all of you. And I'm really happy that Representative Tepler recognized the old guys in the front row in the usual committee setting. So that's was fun to hear. So thanks for that. Reinsurance is clearly not the most exciting topic you're going to have this year, but it's critically important to how we operate, especially for smaller companies, but really all insurance companies need insurance themselves to spread out the risk. So if you take it back to the ice storm, had the main base carriers solely been the insurance outlet covering that, that event, it would have put a lot of financial strain on these companies. So what we do is we kind of shed some of the risk. So we buy reinsurance where we as the primary carrier will insure up to a certain level, and then another amount we will shed and have that risk insured by the reinsurer. So you put that entire package together, it allows for a very strong package of insurance to be offered to the homeowner, to the car owner, to the business owner, so that that risk is spread out. Insurance is a collective pool of risk sharing. We all pay for our auto insurance, and that policy is fairly inexpensive, far less expensive than the cost of replacing or fixing our car. So as a risk pool, we share that risk, and that makes it all affordable for us. And having reinsurance allows that further sharing of risks, and why this is so important. So with the new NAIC rules and the new agreements with the EU and now England, since they have left the EU, it's important to bring in these carriers, these reinsurers from overseas, to make the standards for them in entry to the United States similar to those that are based here in the United States. And that's why this really boring legislation is really important to those of us in the domestic industry. So we applaud the Bureau, we support the bill, and look forward to seeing you pass it pretty quickly. So thanks.
Any questions from the committee for Mr. Sultan? Yes, Representative Matheson, please go ahead.
Thank you, Madam Chair. Thank you, Mr. Sultan. Nice to meet you face to face on Zoom.
Same.
Could you just give me a couple of examples of names of the reinsurers that we're talking about?
Sure. There's a lot of them. Swiss Re is one. Gen Re is another one. I should know many more than that. They're really from all around. These are fairly large institutions that have access to capital, and then they can spread that out amongst their various policies. So those are two of the big ones. I'm sure we can get you a whole list. If you Googled reinsurance, you'll have a bunch of them pop up.
Great, thank you very much.
Yeah.
And now Representative Connor has a question.
Yes, thank you, Madam Chair. Thank you, Mr. Sultan. My question, you had mentioned that it's beneficial for our domestic insurers. My question really is if the insurers domestically are gaining something by reinsuring across the pond, do you foresee any trickle down to the actual folks getting the insurance? Can we see savings by those folks caused by this, or is it just going to be the same amount that they're paying and this is just beneficial for the insurers?
Well, it's not going to be any further discount because we are already doing this. What this bill does is really it deals with the results of an international treaty between U.S.-based insurance regulators and the federal system with these foreign entities, so that there's not a barrier to entry as these rules were codified. So, a lot of times we're reinsuring with United States-based companies. Other entities are offshore. And what this does is to recognize that those carriers offshore that have the similar strength to US-based carriers won't have a higher barrier to entry than those US-based carriers. So it's really providing an equity and recognizing the strength that they have in their home foreign jurisdiction. So we're already playing with these characters and companies, whether they're US or foreign, and this just sort of helps strengthen that relationship of between the United States and these, in particular, elected and selected foreign entities. And hopefully that answers your question.
Yes, sir. Yes, sir. Thank you.
Thank you, Mr. Sultan. I'm seeing no further questions from the committee. Oh, I'm sorry. Representative Quint has a question for you, Mr. Sultan. We'll let her proceed.
Thanks.
Thank you. I'm not really that knowledgeable on this, but I'm wondering if these reinsurers are taking over some of our policies, what authority do they then have over us? Like, what are we giving up in order for them to have that obligation that they're taking over?
They're not taking over anything. And they have, we as the primary carrier remain primary. So you will always interact with us. All of this relationship with a reinsurer takes place at a different level outside of the consumer level. It's a way to actually bring greater financial strength to the primary carrier on your behalf as the insured. So there's really no interaction between you as the consumer to the reinsurer.
Okay, I was just a little confused about that because I was wondering then what their incentive is to do that. If they're not gaining something from it, from us.
Like insurance, they are spreading out the risk and taking, they're hopeful that we don't have an ice storm so that that reinsurance level is pierced that often. So it operates on almost the same principle as primary insurance, where if we insure 100,000 people for auto insurance, we're not expecting all those 100,000 to have an accident of some severity. So we know that through actuarial science and mathematics that some percentage will, and we're hopeful that the premium we charge will allow us to cover those losses and cover the expenses to manage the company. And maybe if you're lucky to get a little profit at the end. And the reinsurance is doing a very similar calculation as to the probability of piercing to a highly, a severe event or a very large event, catastrophe, and what their probability is.
So then we're not giving up the sovereignty of our insurance to them in order to do this.
Absolutely correct.
Okay, very good. Thank you.
Yeah, it actually strengthens it. So.
Okay, thank you.
You bet. It's a great question.
Thank you very much. And is there anyone else on the committee who would like to ask Mr. Sultan a question? Seeing none, thank you for your testimony, Mr. Sultan. And Ms. Pelletreau, welcome, and please present your testimony to the committee.
Thank you, Representative Tepler, members of the committee. Appreciate the opportunity to appear before you today. My name is Catherine Pelletreau. I represent the Maine Association of Health Plans, and I am just briefly expressing our support for this legislation. We wanted to be on the record formally with all of you saying that we support the legislation.
Thank you, Ms. Pelletreau. Are there any questions for Ms. Pelletreau on this issue? Seeing none, thank you for your testimony. I'm letting the committee know now that both Mr. Wake and Mr. Yardley from the Bureau of Insurance are available to answer questions. They don't have testimony to present. The superintendent presented the testimony for the Bureau of Insurance, but they are here if you have any complex questions about reinsurance and how this works for our work session. Nope. Okay. Seeing none, we will close well, I should probably ask if there's anyone else who would like to testify on LD6. Seeing none, I'll close the hearing on LD6 and we will take a short 5-minute break. And the committee should be back at 11:20, please. So that's actually about 6 minutes of a break. And we will begin the public hearing on LD51. I suggest that you both make sure you're muted. And if you'd like to turn off your camera, that's probably a good idea as well. And then we'll be back on shortly. I'd like to ask the committee to please come back online so we can continue our public hearing. Or public hearings, I should say. Well, I think because our time has passed and we want to be timely, I'm going to get started and hope that some of our other members will rejoin in a moment or two. We're going to open a public hearing on LD 51, which is sponsored by our own Mark Blyer. And Representative Blyer, would you please go ahead and present the bill to us?
Thank you, Madam Chair. I don't see Senator Sanborn, but Senator Sanborn, Representative Templer, and members of the committee. I am Representative Mark Blyer, and I am here to present LD 51, a bill proposed by the Department of Professional and Financial Regulations, Bureau of Insurance. The Bureau presented the predecessor of this bill at a public hearing just over a year ago. Interested parties offered comments, and we asked the Bureau to meet with them to sort out the issues. There was more discussion at the work session. After the legislature recessed because of COVID-19, the committee unanimously reported the bill ought to pass as amended. As you know, the legislature did not reconvene, so the bill did not become law. Cybersecurity and the protection of individuals' personal identifying information and personal health information is an essential function at enterprises such as insurers and producer agencies. National and regional enterprises face a patchwork of state regulations concerning protection of consumer information and notification when improper access to that information happens. In late 2017, the National Association of Insurance Commissioners adopted its Insurance Data Security Model Law. This model recognized that state regulators must update the standards for protecting the private consumer information that underlies virtually every insurance transaction. The Treasury Department has endorsed the model and recommended that if adopted, the implementation of the model by the states does not result in uniform data security regulations within 5 years, then the Congress needs to act by passing legislation set forth uniform requirements for insurer data securities. Superintendent Chalpa will explain this in more detail. You may, like Senator Sanborn, you may wish to defer the questions until then, but I would be happy to any questions that you may have. I'd like to thank Superintendent Chalpa for allowing me to present this bill, and I'll take any questions. Thank you.
Thank you very much, Representative Blyer. Any questions from the committee for Representative Blyer, even though he said he doesn't want to answer questions, just like Senator Sanborn, I might add. Seeing none, I think we'll pass on to Mr. Yardley from the Bureau of Insurance, who's in support of the bill and who I think will be standing in for the Bureau at this time to present their reason for supporting the bill. Welcome, Mr. Yardley. I can see
Thank
you.
you.
Great.
Thank you, Representative Templer. I clicked the mute and stop video button, so I hope I can see myself and I can.
You are visible and audible.
Great. Thank you very much. And I just wanted to say two things. We have an uncontrollable home security system that has 8 legs and is easily triggered by innocent pedestrians who go by our house. They've been quiet all morning, and I hope they stay that way. But we will see what happens. Also, I want to thank Representative Blyer for sponsoring this testimony, and I wish to greet Senator Sanborn, you, Representative Templer, and other members of the committee. I am Ben Yardley. I've been introduced to you last week, I think. I'm a senior attorney at the Bureau, and I'm here to testify in support of LD 51. As Representative Blyer mentioned, this bill predecessor of this bill was presented to the former incarnation of this committee last spring, early winter actually, and it did not make it through the legislature because of the pandemic shutdown. The committee did consider the previous bill at length, and after amendment that the Bureau worked out with various interested parties, unanimously voted the bill ought to pass. This bill has a few minor technical corrections that I discussed with Director Ed Charbonneau of the Revisor's Office, but it is otherwise similar to what we presented last year. The bill would add a chapter to the insurance code entitled the Insurance Data Security Act. The purpose of this bill is to establish standards for data security and the investigation and notification to the superintendent of any so-called cybersecurity events. This law would apply to insurers, to agents, whom we refer to as producers, and other entities that the Bureau of Insurance licenses or should license because of their activities in Maine. After the Anthem Group reported a major security breach in early 2014, the National Association of Insurance Commissioners coordinated national efforts among various interested parties to discuss data security and investigation and notification standards for the insurance industry. And as Superintendent Chapa mentioned in connection with LD6, this the NAIC effort here was carried out by other insurance regulators throughout the United States and the territories, and so this really represents what the best consensus of how the NAIC members felt that these issues should be addressed. These efforts resulted in guiding regulatory principles for effective cybersecurity in April of 2015, and a roadmap for cybersecurity consumer protections at the end of 2015. And in late 2017, the NAIC adopted the Insurance Data Security Model Law. This bill closely follows the model with the changes adapted to Maine law. And since 2015, several federal bills have been introduced that, among other provisions, would have set minimum standards for safeguarding information and investigating and mitigating data breaches, and would have prevented the states from imposing any additional requirements or prohibitions. One bill would have prohibited more than one regulator from requiring mitigation after a breach. Although these bills did not move forward, federal support for such initiatives highlights the challenge faced by states as we seek to preserve our consumer, the protections that we give consumers in our jurisdictions, while we also recognize the insurance industry's need for consistent standards and procedures. Data collected by insurers, particularly health insurance, is especially attractive to hackers. Insurers simply have more sensitive consumer data than nearly any other type of business entity, ranging from social security numbers and credit card or bank account information to personal information such as healthcare data. And because they collect and maintain this kind of data, insurers are at a high risk of being breached. This bill would undertake several points. First, it would define several important terms, including cybersecurity event, information security program, non-public information, and publicly available information. The bill would apply to anyone licensed by or required to hold a license from the Bureau. It would require licensees to conduct risk assessments of reasonably foreseeable threats that could result in unauthorized access to or use of non-public information, including both information within the control of the licensee and information that's accessible to third-party service providers that licensees contract with. The bill would require licensees, except for those with fewer than 10 employees, including independent contractors, to develop, implement, and maintain comprehensive written information security programs. Importantly, and these programs are not one size. The programs may be commensurate with the size and complexity of each licensee, the nature and scope of its activities, and the sensitivity of the non-public information that it uses or is in its possession, custody, or control. The program must contain administrative, technical, and physical safeguards to protect the non-public information in the licensee's information system. The licensee must also establish a written cybersecurity event response plan, and insurers domiciled in Maine must annually certify their compliance with these requirements to the superintendent. The bill would require licensees to investigate possible cybersecurity events promptly to determine whether an event actually has occurred, to assess its scope, and to identify the information that might have been at risk, and to take reasonable measures to restore any compromised system's integrity. The bill would require licensees to notify the superintendent promptly of any cybersecurity event, no later than 3 days after determining that an event has occurred. And if the licensee's domicile or home state is Maine, or the event involves the non-public information of at least 250 Maine residents, then the licensee must also notify consumers as required under the Notice of Risk to Personal Data Act, which is parked over in Title 10 of the Maine statutes. If there's a likelihood that the event would materially harm any Maine resident, or if any state or federal law requires notice to a government body. And the bill would also allow limited safe harbors for licensees that are subject to the Federal Insurance Portability and Accountability Act of 1996 and Health Information Technology for Economic and Clinical Health Act. Those two laws are respectively known as HIPAA and HITECH. And for insurance producer business entities that depository institutions, otherwise known as banks and credit unions, that maintain information security programs that comply with Gramm-Leach-Bliley. And that last item is an example of that was in an amendment that we worked out with representatives of groups interested in having these protections last year. Concludes my testimony. I'd be happy to try to answer any questions now or at the work session, and be glad to stay on if that's what you would like me to do.
Seeing some questions for you, please remain on the line, Mr. Yardley. And Representative Evans has a question. Please go ahead, Representative Evans.
Thank you, Madam Chair. I want to thank Representative Blyer and Mr. Yardley for this presentation. My question is for education as far as I'm concerned. once the superintendent is notified of a breach, there's the 3 days that it has to be reported. At what level is it determined that the breach is of a significant level to be made public? Is that number of people involved in a company? How does that process work? What's the final determinant?
So I think I understand your question. The entity that's breached has to figure out, first of all, whether there's an actual breach of its system, and then whether it's the individuals whose personal information it holds, whether that information has been compromised. And if that's the case, then the call it an insurance company, for example, has to let the regulator know and start to notify its customers who've been affected. Does that answer your question, Dr. Evans?
Yeah. What I'm hearing is that once the vendor is aware of the breach, that breach has to be reported to the superintendent. That does not prevent the vendor from going forward at that time to notify the public if some individuals are compromised.
No, the entity could notify the public whenever it feels, yes.
Okay. Thank you.
There's no actually, let me clarify that. In some cases, the entity will notify law enforcement, local authorities, or the FBI, and those authorities might say, we want you to embargo public announcement of this while we investigate who the attacking party might be. So in that event, information wouldn't go out immediately. Excuse me, immediately.
So what I hear Mr. Yardley saying is that this bill creates minimum requirements for notification, but it doesn't limit maximum possibilities for notification.
Correct.
Yes. So next, we have a question from Representative Melorano. Go ahead, Representative Melorano.
Thank you, Madam Chair. Thanks, Mr. Yardley. Yeah, it's actually a similar question to Dr. Evans's question. And is there a, specifically, is there a time period where the licensee is required by a certain amount of time to inform the consumer that their data has been compromised? Because the consumer may have to restrict their bank accounts or freeze their credit, or so I feel like I know we've had this discussion before. I hate to sort of continue to open up this can of worms, but I feel like the amount of time was a long amount of time where they could go without notifying. And I understand that it's sort of tied in with law enforcement and the investigation, but is there a certain amount of time?
Yes.
Okay.
So, and you'll recall that I briefly mentioned a statute over in Title 10, the Notice of Risk to Personal Data Act. And that's a state law. Many states have very similar statutes going back to the early 2000s. And it applies to, the Notice of Risk of Personal Data Act applies in Maine to any number of entities, including entities that we regulate, some of our associated agencies in the department regulate, and anybody who's not regulated by a state agency. It applies to the Attorney General. And Notice of Risk of Personal Data Act requires notification, again, subject to the law enforcement hold, to affected parties. I think the phrase is as soon as practicable. And I believe a few years ago, the legislature enacted a 30-day requirement for notifying people whose data has been affected. So these two, our bill and Notice of Risk of Personal Data Act kind of work together. Our bill is more about notifying, making sure that there are standards to protect information, and making sure that the superintendent is notified when insurance entities have problems. It works also with the Notice of Risk of Personal Data Act and making sure that consumers are notified.
Do you have a follow-up, Representative Melrano?
No, thank you. Thanks, Madam Chair. Thank you, Mr. Yardley.
No problem. Welcome. And Senator Stewart, you have a question for Mr. Yardley.
Thank you, Madam Chair. Thank you, Mr. Yardley, for your time this morning. I'm somewhat familiar, even though I'm new to the committee, with several of these procedures because I've taken in my law school teaching last semester information security and data privacy law. And the question that I have for you is one that I struggled with all last semester, and one that maybe you'll be able to answer for me. But it's a question about reasonableness. And what does reasonable mean in terms of when a company should know, and when they have reason to know? What is reasonable in terms of the protections that they need to be putting in place to ward off cyber threats? So I'm wondering if you could speak a little bit about that, because when it gets right down to it, that word is what everything sort of hinges on. What is reasonable? So maybe you can help me better understand that.
I will try to. Reasonableness is probably it's a very subjective standard, as your question implies. What's reasonable to one person might not be so obvious to someone else. And so the model tries to accommodate that flexibility by, or indefiniteness is a better word, I think, tries to accommodate that indefiniteness by saying, look, what's good for Unum or Anthem in terms of what they should be doing isn't going to necessarily apply to a small independent insurance agency that is going to be perhaps less at risk. So I think that what underlies the model is a requirement that responsible individuals in the insurance industry take a good, thorough look at how big their enterprise is, what kind of information they hold that their customers entrust them with, who their business partners are, who help the entity achieve its business goals, and making sure that those business partners are responsible individuals. And then when an actual event occurs, undertaking to investigate it in a way that is going to reveal accurate information about what took place. I think it's hard to get much more specific than that. I will I guess take the attorneys, the lawyers dodge that it's going to depend from circumstance to circumstance what's reasonable.
Thank you, Madam Chair. I've got a quick follow-up, just to sort of clarify that, I guess. And I think I suspect that I know the answer to this question, but the long and the short of it, at least as I've sort of come to understand it, is that depending on the situation where there is a breach and the things that happen before and after that event, what's reasonable is pretty much left up to the discretion of your office and the superintendent. Is that pretty much the case?
That would be, I think that's a fair thing to say. I can tell you that, I came to the Bureau in 2004, shortly after the Notice of Risk to Personal Data Act was enacted, and one of my first tasks was monitoring breaches. So I receive information when these things occur. I ask questions that are designed to try to figure out what's happened. And I've had helpful follow-up conversations with mostly insurers. I can think of one or two other entities who are not insurers who have reported events. My goal, which I think is consistent with the superintendent's, is to make sure that companies have good systems to protect the data. And if there's a problem, they let us know and they let their customers know, and provide helpful remediation. And remediation, I think, can be both providing customers with the option to have monthly security monitoring. I'm sure you've received scores of letters offering this, but I think remediation also involves companies making sure their systems are capable of responding to the events that they've had. I hope that has answered your question, Senator.
It does. Thank you.
You bet.
Thank you, Senator Stewart. And I see your hand, Representative Connor, but I'd like to just follow up for 1 second real quickly, Chair's privilege with Mr. Yardley. Mr. Yardley, I guess my question, which is a follow-up on Senator Stewart's question, is what happens if you make a determination of unreasonableness in an entity's behavior?
So we have enforcement authority. I should say we haven't done this. We haven't had to take enforcement action with respect to a data breach. Going back to the Anthem data breach, the lead states, and Maine was one of the lead states involved. Anthem's home state was principal. The superintendents and insurance commissioners worked to make sure that Anthem had adopted reasonable procedures and undertook appropriate remediation efforts on behalf of his customers. Does that help you at all?
Yes, I think it does.
And I should say we can impose penalties, and there were some penalties imposed in the Anthem situation, but really I want to emphasize that our goal here isn't punishment, it's protection.
So I'm understanding you to say that this preferably you'll be involved in cooperative relationships with the entities that you're governing in this case.
That's been my experience so far.
Thank you. And Representative Connor, please go ahead.
Thank you, Madam Chair, and thank you, Mr. Yardley. I just have two quick questions, if you don't mind. First is, does the department anticipate any added infrastructure or labor requirements to oversee this, since this is a new program? And my second question is, does the department anticipate any added cost to consumers by imposing this on these companies for them to implement this?
No, and this stuff is already going on. The insurers, Anthem was a wake-up call. So now it's hard to believe that's 6 years ago. And so over this period, insurers and other entities in this world of insurance have really started to focus on best practices, making sure that boards of directors are involved in understanding what their enterprises are up to. I don't foresee any new costs to the Bureau.
Thank you very much, sir. I have no further follow-on questions, Madam Chair. Thank you.
Thank you very much, Mr. Yardley and Representative Connor. And I see that Representative Arford has a question. Please proceed, Representative Arford.
Yes, thank you, Madam Chair, and thank you, Mr. Yardley, for being with us today. I find this fascinating because, as most of us, I've been a recipient. We were recipients of the data breach with Anthem, and I've thought a lot about it ever since then. And one of the questions I have for you is the data that is actually generally, accessed by someone who's hacking into a system such as Anthem's. We know that they're accessing patient protected information, but are they accessing information that would be of harm to the insurance entity themselves? Like, for instance, their charge data, or their negotiated rate data, or anything that they would themselves absolutely unequivocally not want someone hacking into the system and obtaining. In other words, it wouldn't directly harm their members or the consumers, it would harm their business operations.
I would defer to the insurers who are likely to follow me, but I would hazard that, yes, that kind of information they would very closely want to guard. Information related to their business plan.
Thank you.
Okay, thank you very much, Mr. Yardley. Seeing no further questions from the committee, I will next turn to other supporters of the bill. And right now we'll hear from Mr. Bernier from the Maine Insurance Agents Association. He's still on? Yes, he is. Good.
Can you hear me?
Yes, Mr. Bernier, we can hear you.
And
you.
Good morning. My name's Dan Bernier. I represent the Maine Insurance Agents Association and the Maine chapter of the National Association of Insurance and Financial Advisors. We support this legislation. This is based on and pretty almost identical to the NAIC model law on cybersecurity. This law represents our best hope to get uniformity across state lines while preserving local enforcement of cybersecurity laws. Even a very small insurance agency might be licensed in 7 or 8 states. And if we end up with 7 or 8 different cybersecurity rules, that could be quite cumbersome for some of those smaller insurance agencies. This law is moving through in a number of other states right now. And again, I'm not going to guarantee you every state passes it, but it's our best hope to get uniformity across state lines, which is very important to us. One of the things too is this law provides, as was noted by some of your questioning, a great deal of flexibility to the regulator in determining reasonableness. If we're going to give a lot of flexibility to a regulator in determining reasonableness, we would like to have that be a regulator here in Maine who we can sit down and have a conversation with, rather than a regulator in Washington, D.C., who might be less inclined to sit down and have a conversation about some of the issues a small agency located in Maine might face. In reviewing the bill, the committee passed this last year and they amended it, and then it got caught up in COVID. It does appear to me that the Bureau included at least what were the important portions of the committee amendment from our perspective, which was mainly the treatment of independent contractors. We wanted to be clear that when you're counting independent contractors for cybersecurity, you're counting people actually involved in the business of insurance. You're not counting the guy who mows the lawn or the guy who plows the parking lot and have no access to client information. And I did note that that wording, which the committee added a year ago, is in the actual draft before you. So the committee doesn't need to re-amend the bill with what we asked for a year ago. With that being said, I'd be happy to take any questions the committee has.
Any questions for Mr. Bernier from the committee? Seeing none, thank you for your testimony, Mr. Bernier. And I would invite anyone else in support of the bill to testify. Seeing no one messaging us that they wish to testify. So I will move to anyone testifying in opposition to the bill. Seeing no one wishing to testify in opposition to the bill, I will move to neither for nor against. And first on the list of neither for nor against that I have is Mr. Garrity. Please join us, Mr. Garrity.
Can everybody hear me now? This lag between the notification that you're going to speak and then actually coming on is a little bit disconcerting for us, but I think we're all trying to get used to this. Let me start, if I could, Senator Sanborn and Representative Kepler, by saying that I represent APCIA. To give you a little more flavor, APCIA is the American Property Casualty Insurance Association. It is the largest association of property casualty insurers in America. It represents a majority of the insurers that are doing business in the state of Maine. It has some domestic companies. It certainly has some of the very large insurance companies that you would have heard of, the Liberty Mutuals and companies like that. And they strongly support the notion of having privacy protection and data security standards in place. That having been said, we do have concerns with this draft. And by way of being full disclosure, these concerns were raised with the committee in the 129th legislature. They were raised with the superintendent in a meeting that he held. And the concerns that I'm going to raise are ones that did not make it through to the final draft and then the bill that came out of the committee. We think they're meritorious concerns, however, and hope the committee will consider them. Again, by way of general comment, the NAIC does a number of bills of importance and creates a number of different models. A NAIC model is not locked in stone, however. States amend these laws regularly. For example, one of the concerns that I'm going to address in just a minute has been adopted by 10 of the 11 states that have passed this statute. The fact that some amendments are made does not bring a state's legislation out of compliance with a generalized standard of, are you protecting data security? Does this exempt you from congressional oversight and the like? The two primary themes that I think are important from our perspective and for the committee to discuss is first, the notion of non-public data, and second, the notion of materiality. Public data, your phone number, your address, things that anyone can get their hands on if they wish, is not the kind of information that this legislation is intended to address. It's intended to address social security numbers, other private information that we wouldn't want out in the public in the public eye. So that's one of the main focuses. And if you look throughout the statute, there are proposed legislation. There are references to non-public data throughout the statute. And I'll point to one or two of them as we move along. The second point that I think as a general comment is important is the notion of materiality. Insurance companies, large and small, have pretty sophisticated plans in place to protect the confidentiality of data. And one of the questions that you're going to be asked by us to look at is, should information be reported to the Bureau by an insurance company if there hasn't been a breach of anything that could relate to private or material information? If an insurance company notices a first firewall being dented, so to speak, by a hacker, and that firewall relates to addresses, and it's dealt with by the carrier, and they respond very quickly, we believe there shouldn't be a reporting requirement to the Bureau. If something that could relate to private information, something that's really significant happens, Anthem has been cited as the example, then of course we think that should be reported. What I'd like to do with those two primary thoughts in mind is direct you to several provisions in the proposal that we think should be amended. Starting right off, and what I'm going to do for members of the committee who may not be as familiar with this process is reference sections and pages and lines of the legislation itself so that you can look at what I'm looking at. On page 1 of the bill, on line 8, the construction of the statute references that it sets standards for data security. And it goes on to say, and exclusive standards for the investigation and notification to the superintendent. We believe the word exclusive should be placed after the words this chapter establishes. We think this should be the sole standard that is applied to entities that are regulated by the Bureau of Insurance. There are other privacy laws, and I'm not referring to chapter 210B yet of Title 10, which other people have referenced. But we do think that this should be the sole source for regulation of insurers with relation to data security. The second change we would recommend is again on page 1, and it's line 24, which is part of the definition of what is a cybersecurity event. That's one of the keys in this bill. If you don't have a cybersecurity event, then there is no reporting requirement at all. And what it says now is that if there is access to or disruption of or misuse of an information system, well, we believe that in front of information system, it should refer to non-public information. Again, there are so many different levels of protection and so many different kinds of reporting that are already required. If you make us report every single attempted breach of a system, regardless of how benign it might be, regardless of how quickly it is caught, you're requiring a lot of disclosure that we think serves no real purpose to benefit the public. And when, again, we move on, I want to point out to you some of the things we're already required to do, which will protect against anything like non-public information being reported. For example, when you look at a cybersecurity event, it generally references, and as you move forward in the bill, it references non-public information. For example, page 1, line 30, a determination that non-public information has been accessed. That is the key, and we don't think a broad definition that includes public information potential breaches should be included in the statute. The next point I'd like to bring to your attention is in section 2262, page 1, line 24, which again, we suggest putting in the word non-public. Moving on from that, section 2266 sets forth the materiality standards. But before we talk about materiality standards, when you have a moment, I would urge you to look at pages 3 through 5. And this is the information security program that has to be developed for every carrier. And I would suggest that these are really important standards to have in place. But if you look, and I'm on page 3, line 30, the objectives of an information security program. What it references, and we don't object to this language, protect security and confidentiality of non-public information and the security of information systems. Sub B on line 34, protect against reasonably foreseeable threats or hazards of non-public information. I won't keep going down the list, but you will notice A through D in other sections of the bill reference non-public information. If you also look at the requirements that a company has to engage in, they have to have policies, procedures, safeguards in place. This is all of page 3 through 5. There has to be a risk management assessment. There has to be a plan in place. That has to be reviewed with the Bureau regularly, and it goes so far, and again, we're not objecting to this at all, as to require direct oversight by the board of directors of an insurance company. That means, regardless of whether we're talking about a relatively small regional company or some of the largest companies in the world, that there has to be direct oversight by the board of directors. And again, we don't object to that. It is a reflection of how important this legislation is, but it's also a reflection of how well developed these standards are. And that in turn leads me back to section 2266, which starts on page 7, line 22. And that's where you start having the notification requirements to the superintendent. We believe that there should be a standard placed in 2266 that says there has to be a material event that occurs rather than a cybersecurity event. Going back again to the materiality point I made at the outset of my comments, there can be all manner of potential efforts to breach a system that are caught right away. They're not material. They don't damage the public in any way. And in fact, they demonstrate the effectiveness of a company's systems. Those shouldn't need, in our view, to be reported. At some point, you could be in a situation of reporting so many events that you lose track of where you're really trying to go, which is to protect against anything that can materially create a risk to consumers of a cybersecurity event. So we urge you to put in language suggesting that there has to be a materiality standard. Going back to the bill itself, another provision we're concerned with, and this sort of echoes a comment that Mr. Bernier made in support of the bill. We believe there should be a safe harbor that recognizes that other states have systems, and if one has to comply with another state system, as long as the standards are essentially equivalent to or stronger than Maine's, that whole standard and system ought to be recognized as complying with Maine law. Now, this is something that was recognized in an NAIC comment. Many insurance companies are licensed in New York State. New York State has an extremely rigorous system, and the companies went to the NAIC and said, look, if we're in compliance with New York, that is so strident, then can we be deemed to be in compliance with other states? And I believe in our comments, we cited to the language, the note, when the NAIC looked at this. Just as Mr. Bernier doesn't want to have to deal with 6 or 7 or 8 different states, if we don't want to have to do that either, if we can avoid it. So I think if you put in a standard, and we did propose language that says we're meeting the requirements of another state and they're just as strident as Maine's for a multi-state insurer, then that should pass muster. The other point I want to make, and I'm going back now to the comment I made about the NAIC being amended. I believe it's 9 or 10 of the 11 states that have passed this have put in a materiality standard. South Carolina, which was the first state to enact this, did not. This legislation does not. Again, in the interest of full disclosure, I know the superintendent doesn't support putting in a materiality standard. We think it's appropriate, and we would ask the committee to recognize that states around the country are doing this, and it's a reasonable thing to do to avoid over reporting and unnecessary reporting. The last point I'd like to make, Madam Chair, relates to the effective dates, which are at the very end of the legislation. When this legislation was put in, we had 2022 and 2023 as the dates on which various portions of the bill would become effective. We believe those should be moved out a year to 2023 and 2024. I think that recognizes, first, that it takes time to put these systems in place. Second, and more importantly, even though companies have been working on these different programs and have them in place, the reality is COVID has really impacted what everyone is doing. And we believe that just as the original bill proposed a 1 and 2 year gap between enactment and enforcement, moving this up a year, we should move those dates up a year. Those are my comments, Representative Tepler, and I would be happy to try and answer any questions the committee might have.
Thank you, Mr. Jarity. Before I jump to questions from the committee, I would like to remind the committee that the committee disagreed with many of Mr. Garity's concerns last year. That in fact, the issue of materiality having to do with notification of consumers is very clear in the bill. However, notification of the superintendent is not. And the question really remains, do we want the superintendent to be tracking some of these attacks that rise to a certain level, even if they may not rise to a level where consumers need to be notified? So part of the issue here is what we want our superintendent of the Bureau of Insurance to know, not just what we want consumers to know, because this bill is primarily about notification to the superintendent. We have the other title in 10A to deal with consumer notification. And so I just like to remind the committee of that, because I don't know if Mr. Jarity's objections really rise to a level that we want to deal with in terms of notification to the superintendent. So I just have to add that in there. And with that, I'll turn to the question from Senator Stewart.
Thank you, Madam Chair, and good to see you, Mr. Garrity. Hope you're doing well. On page 1, and I feel like I've sort of boiled down a lot of your testimony to the discrepancy or maybe a disagreement about what a cybersecurity event is, what that constitutes, what it does not constitute. I can understand, some of the possible reservations that, your clients might have. But as I read particularly the section which defines it on page, I believe it's page 1, line 23 is where it starts. And it explicitly says what a cybersecurity event is and what it is not. And if you look at what a cybersecurity event is not, which is the unauthorized acquisition of encrypted, non-public information, and then it goes on to say, does not include an event with regard to licensees been determined that non-public information accessed and authorized by persons user which has been returned or destroyed. I guess I'm more zeroing in on that second line, the second paragraph, where if the information is encrypted, it doesn't constitute a cybersecurity event at all. Now, that would be, I suspect would be best practices anyway, that information that is non-public, which if what we're talking about is things like social security numbers, personal health information, access codes, and the like, they would likely be, encrypted anyway. And so if it's going after any of that information, doesn't count. And if it's going after information that is that is public information, such as addresses, which don't count, then that doesn't count. And so I think the crux of this is you equated it to dents on the door, right? I think is what you mentioned, it like a dent on the firewall. But that's really not what we're talking about. What we're talking about is where information has actually been accessed that is not encrypted, which would be probably bad practice for a business that has that sort of information anyway. So I think that is sort of the rub. If I was able to boil down much of your testimony to one specific issue with the bill, I think that's it. And so I guess my question is, are we on the same page there, or are you and your clients interpreting that language to mean something entirely else that you feel is important that we understand before we do anything with this bill?
Thank you for your question, Senator. Let me respond this way. If you look at the opening paragraph, it references any event as opposed to a non-public event. And my point was, to the extent that your concerns with non-public information, that the language should be consistent. And anytime you have an inconsistency in language, you have the potential for a problem. And as we all know, in legislation in particular, the devil is always in the details. And cybersecurity event should say non-public, just as the following two sections reference non-public. You're making your reporting far broader than what you're trying to protect in terms of unauthorized acquisition of encrypted data. And that's, I appreciate your question, and that's why we want non-public in there. We think it has to be consistent throughout the statute.
Can I follow up, Madam Chair?
This as frankly, we characterize this, and I think we did in our written testimony, as a technical amendment.
And I suppose I can understand that, but I guess that my question is, does not the second line in that part 3 cybersecurity event, does not that second sentence clear that up, or do you need more clarity about what it is that we're talking about?
We believe clarity in referencing it as a non-public event is helpful. It isn't weakening the statute in any way in terms of what you're trying to protect. And it promotes consistency. So I guess I know that's pretty much what I said a minute ago, but I think that's why we're calling this a technical amendment rather than a substantive amendment. The materiality provisions are really substantive, as Representative Tepler mentioned a moment ago. We see this as a technical change.
I actually have a question for you around that, Mr. Garrity. If there is a breach of what you're calling public information, that is the existence of certain addresses in the databases of particular insurance companies, do you think it's reasonable that a hacker should have the information that everyone whose information is hacked, even though it's public information, has a relationship with that particular insurance company? Is that ostensibly public information that I have a relationship, let's say, with Aetna?
That piece of it isn't public. However, the information is what you're trying to protect. And as I mentioned in my testimony, this entire bill is geared towards protecting non-public information. And no one is saying that any kind of a breach, or I'll continue to use the word dent in all the firewalls, and there's many firewalls, shouldn't be addressed, and companies do address them. What we're saying, Representative, is that that doesn't rise to the level of having to be reported to the Bureau. And the reason we say that is because hackers, kids who want to demonstrate they can get into a system, anybody or his brother can try to get into a system, and it's over-reporting to make us report those events. And that's what 2266 is geared toward.
I guess my concern with that, and my question for you is, where do we draw the line at our Bureau of Insurance, understanding the degree to which systems that hold private information are being attacked in the state? And what kind of information do we want our Bureau of Insurance to have about the number of attacks, when they're occurring, who they're occurring against? I mean, to me, it seems that that is information we want our superintendent to have.
I don't disagree that you want the superintendent to be aware of any kinds of breaches that pose any problem to data and private information. But I think that the standards that you're putting in place to protect the public, and the standards that you're putting in place as to what insurers are required to do, what information they're required to maintain, the development of plan, all those different things provide the Bureau in the first place with data, because there's an annual reporting requirement to the superintendent. And they're letting the superintendent know just how serious a company's efforts are. So I think that's where the information of the company, from the company to the Bureau, has to start. But I'll bring it back around, Representative. I don't think it helps the Bureau, and I think it results in over-reporting if we have to report that some kid in a high school somewhere tried to break into the system, didn't get very far, didn't accomplish anything by way of information that's protected, and have to report that. We just think that is over-reporting. And when you said, what should the superintendent have? I think that goes back to what Senator Stewart said, and in part what I've been saying, whether it's a standard of reasonableness, whether it's a standard of materiality, there should be some standard below which you don't have to report information. And I don't think you have that guardrail really in the statute as it's drafted. Or at least we don't believe that it's that clear, which is why we're suggesting the materiality language.
Thank you, Mr. Garrity. Anyone else on the committee have a question for Mr. Garrity? Nope. Seeing none, Thank you. Oh, I'm sorry. Representative Evans does have a question for you, Mr. Garrity.
Hi, Representative.
Thank you, Madam Chair. I'm having a little difficulty with understanding the reporting responsibilities, and I'm concerned about the quantification of those. In your last statement, how are you going to separate? You know, it takes some investigation to figure out what's going on with one hack or another, but a hack, in my opinion, is still a hack, and I think that deserves attention.
I appreciate that question.
That's so.
I'm sorry?
I was just making it a question. Isn't that so?
Oh, isn't that so? Yeah. Right now, there is no standard, Representative. The provisions of the notification provisions just say that if there's been any kind of a breach of the system, you have to report it. If the committee, and this is what the committee decided last session, the committee said, yeah, you know, we think that's okay. And we think that's what's appropriate. But we've suggested all along there should be some minimal or appropriate level below which you don't have to report. To answer your question directly, when you say, well, you're concerned with any hack, I understand that. And if that concern is so broad that you believe everything should be reported, then I think you would stay with the language that's in the bill. We simply think that is over-reporting.
Understood. Thank you.
Representative Arford, please go ahead.
Yes, thank you, Madam Chair, and thank you, Mr. Garrity, for coming and speaking with us today. I found your testimony very interesting and enlightening, and I thank you also, Dr. Evans, for your comments, because that was partly what I was going to say as well. And the only thing I would add to that was that I would like to see us further explore is when we talk about public or non-public information, that's really a value judgment. As legislators, we make our addresses, our phone numbers very public. There are many people out there who don't do that and who do not want even information that we would consider public to be public. So when you refer to public information, such as address, phone number, whatever, being accessed through a hack, and you assume that that would be acceptable to the people, I would question that. And I would like us to continue to explore that.
Isn't that so?
Isn't that so? Well, I understand the concern you're raising, Representative. I guess I'm trying to think of a good analogy, and not one is coming to mind, but there are situations and circumstances where you don't have to report things. For example, maybe I can do it this way. If you look at Chapter 210B of Title 10, that's the other law that we've been referencing. Section 1348, and I know Colleen can make that available for your work session. It talks about security breach notice requirements. And it basically says if an information broker, which is anybody who has the information, maintains data and it has to conduct in good faith a reasonable and prompt investigation to determine the likelihood that personal information has or will be misused, and then notify people when that happens. That's a standard that you already have in a statute that says the information has to be the kind of information that can be misused. The standard the superintendent is asking for is a far, far broader standard than that. And I understand that. And I understand the superintendent should have more information because he's the regulator or she's the regulator. And as soon as they get this information, they can address it if they think it's necessary. But I don't think you go from 60 to 0, which is what this bill does, The consumer protection standards reference a certain standard. This really doesn't reference standards. So that's why we think the materiality language has to go in. And I appreciate the concern you raised, Representative.
Thank you.
Thank you, Representative Arford and Senator Stewart.
Thank you, Madam Chair. Very quickly, just for the work session, I think it would be helpful to have for the committee, and I don't know who this request would be made to, perhaps our analyst, perhaps Mr. Garrity, perhaps anybody that's listening. Definitions of what different types of information are and how they are protected in different ways through different programs. You've heard a couple of people talk today about HIPAA, which is probably the most common one. You've heard some talk about high tech and a litany of other protections that exist, just so that we're on the same page when we talk about what is personally identifiable health information, what is personal information, what is, and because there's different standards of protection that are required for each one of them. Because we're quickly going down a rabbit hole where we might feel one way about, whether the information should be or not, but what is the legal standard federally and at the state level, I think would try to, cut to the chase and get us all on the same page. Thanks.
If I could just make one point in regard to that, Senator, and it's something I think the committee should consider. 10 of the 11 states that have passed this have said it makes sense to have a materiality standard. That's an overwhelming majority. That doesn't mean we have to do it in Maine. South Carolina didn't do it. South Carolina stayed very closely to the language of the model. But I do think it's appropriate for the committee to look at what other states are doing, to inform themselves at least what these definitions are in other states and the standards are in other states, which I think is what Senator Stewart was referring to.
Thank you, everyone. I think that Ms. McCarthy-Reed is all set to provide us with that information, or to make sure someone provides us with that information for work session. I think that we are all set with testimony from Mr. Garrity now. And we still have 2 others to testify neither for nor against. First up is Mr. Sultan, if he's still here. Yes, he is.
I'm coming.
Thank you, Mr. Sultan.
Thank you. Representative Tepler, members of the committee, my name is Charlie Sultan. I'm here on behalf of the Maine Association of Insurance Companies, again, the Maine domestic property and casualty carriers. My testimony is generally a me too to Mr. Garrity's. First, this is a fascinating issue. It's one that this committee first started wrestling with on the privacy of consumer information. I bet you we were one of the first in the country to get a comprehensive law. Had to be at least 15 years ago. I can't even remember. I had a lot darker hair and so on. So Maine is really strong in this area. And I reinforce what Mr. Yardley says. I mean, this bill really is about us as carriers, especially us domestics, reporting to the superintendent events that happen on cybersecurity and potential breaches. Companies take an inordinate amount of time and people power to combat this issue and confront it and protect their systems and the information contained in it. About a year and a half ago, I believe both Bruce and I were involved in a merger of 2 very large health entities. And in the hearing before the Bureau, the large part of the hearing actually dealt with cybersecurity and the efforts that those companies took to protect information. And the discussion was fascinating because of really the intense effort and the sophistication that companies, utilize to protect the information of their insureds. So it really is a important issue. It's one that everyone takes seriously. And because so many companies are in multiple jurisdictions, which is important to have a strong and robust model law. Now, the model law out of the NAIC kind of was rushed at the end, and the time it was being pushed by the Commissioner of South Carolina, and that is why South Carolina was the first state to pass this model law when he took it back. I think he was leaving his role as chair. But since that time, the model has been tweaked as the rest of the commentary and discussion and debate occurred, and it was given a massage in order to make it more reasonable to comply with. And that's kind of what we're arguing about today. We are absolutely in full support of the framework of this bill. We as domestics could not have a better bureau to work with. And just to give you a real example of how this works in real life, if one of my clients, and I also represent, Cigna and so on, if there is a breach, I get notified as, local counsel, and then I pick up the phone immediately and call someone like Ben to report an event. And based upon the information the carrier has been able to gather, we then can make some conclusions as to the severity of that breach. And that's important. We may not know as the carrier the full extent of that breach. And as you have seen through the ever increasing knowledge we're getting about the SolarWinds breach, how those particular breaches impact a system or a group of systems, or how wide it is, either inside a carrier system or a third-party vendor system that's been used to get into that system. It's all very complex, and it takes some investigation. But we make that phone call, and we open that dialogue in order to give the superintendent the best information possible. And so I think as a result, the framework of this bill is absolutely appropriate. It makes sense. It is, as Ben said, stuff that we are, for the most part, complying with already, because we, as all businesses, hopefully, have been taking the cybersecurity threats seriously over the last number of years as they've gotten more sophisticated and certainly more prevalent. But I think the issues raised by Bruce's clients and others on the health side, our question to you really is it worth to spend a little more time before Thursday to talk about these issues, and can there be any further agreement? If you say no, then that's no. And if the Bureau really doesn't want to, then we'll obviously abide by it. But we're kind of asking for a little further discussion to try and keep that uniformity, as these other states who have adopted it before us have made these similar changes, and is that appropriate? So that's really what we're asking for. When we first started arguing about this law years ago, there was an assistant attorney general who I was having a robust discussion with over at the department, talking about public information versus non-public. And I was like, you have to remember what public information is. These used to be thicker, phone books, but those are full of all of our addresses, on phone numbers and stuff back in the day. And it was, is that what we're talking about? Or is it really more of the critical information about how much insurance we have, what our health data is, social security numbers, other identifying information that can be pulled from multiple sources by hackers who then try to mold that into a composite profile of us as consumers. So that's really kind of what we're talking about. I'll leave it at that. And just to answer one question I know Senator Stewart has, is that yes, my hair is much longer than it ever was because of COVID. And I just have to be careful of where I go. So I haven't really got much cut lately.
How did you know?
I know. Thank you.
Thank you, Mr. Sultan. Are there any questions from the committee for Mr. Sultan? I just want to clarify, oh, I see there is a question, but I want to clarify before I go to that question, Mr. Sultan, that you are asking for more discussion with the Bureau before we take this bill to work session?
That would be helpful. I know the Bureau is probably reluctant to do so, having had a brief conversation with them this morning. But that's kind of the policy question. Trying to make the best policy possible. Is it worth one more round of discussion to get the best bill that we can get?
And I guess we'll, as a committee, think about that and answer the question at the end of this session. Representative Quint, please go ahead with your question.
Thank you, Madam Chair. I'm not really sure how this collides together, but on LD6, we're talking about having information or insurance companies from overseas joining in with our insurance. And so I'm assuming that they would have access to our information as well. And I'm just wondering if the LD51 ties into that, what the information that they would be responsible to reporting to us if they were hacked over there with our information. And I also wanted to find out if with LD6 and LD51 together, if it's actual medical information or if that's just property casualty insurance that's included with the LD6. Because it seems to me that they're tied together and there could be issues with privacy with insurance companies that aren't even within Maine or in our country. Am I correct in that or way off base?
You raise a really interesting point. I'll have to get back to you, and maybe someone else from the Bureau can tell you right away. I don't know how much access to personally identifiable information or private information that the reinsurers actually have access to. They certainly don't have access to our systems and so on, because it's a contractual relationship and particular events will trigger the contractual exchange of money on claims and things like that, depending upon the level of severity or the breadth of the event. So I'm not sure they have really that kind of access. As a standalone insurance company or a reinsurance, especially as a foreign domiciled company, I haven't thought about how this would apply to them. Certainly if there was a hack, they have to report to their own jurisdiction. And in the treaties that go back and forth between the EU and the United States and England, Great Britain and us, I don't know how that's treated. So that probably is a question someone else will have to answer. It's fascinating. But all of this does apply to both what we call both sides of the house in the house of insurance, property and casualty on one side and life and health on the other. So all of this applies across the board. And we all have different kinds of private information about us as consumers and so on. So clearly, P&C carriers have some health insurance because we insure auto claims, workers' compensation, things like that. Life insurance is going to have other kinds of information on health as opposed to a health carrier who's going to have more ongoing health information. So they're kind of discrete buckets, but similar.
And I guess I would also comment, Representative, that we have a reinsurance program here in Maine for our health insurance called Megara. But what reinsurance is, as we're talking about in LD6 is a contractual relationship between insurance companies and other entities that offer reinsurance. And what that means is they say, we're going to cover all claims. We have the financial ability to cover claims from our clients up to whatever that level is. I mean, and then if there were something like an ice storm or another terrible emergency, a hurricane in Maine that created an enormous amount of damage along the coast, we might not be financially able at the time to cover all those claims without your contractual assistance. So there's really, in many ways, I don't think, and I need to confirm this with the insurers, but I don't think there's an issue of information about who the individual clients are. The relationship is actually between the reinsurance entity, which is providing cash backup to the insurer. And it's not a relationship. Colleen, can you verify that for me? And either agree or disagree, give us a little more information about that.
Yeah, I'll follow up with the Bureau of Insurance to confirm, but I think you're on the right track there. So
thank you. So it's highly unlikely that those reinsurers would be holding personal information, public or non-public, of individual insured entities in the state of Maine.
Okay, because my main concern with that is that insurance agencies do have access to that. It goes in with their insurance clauses. And so if someone else is signing on to that insurance, it would also allow them to have access to that information. That's just factual. And so I just had some concerns about that. I was just wondering how this would tie in and whether or not there would be the appropriate reporting from other insurance agencies that may be doing reinsuring with us. So that was just, if I could get some clarity on that, because I'm a little concerned with the privacy aspect of that.
I think that Ms. McCarthy-Reed will make sure we get some clarity on that.
I appreciate that. Thank you.
Sure. And Senator Stewart, your question for Mr. Sultan, besides your lip.
Well, I'm not going to ask him who his barber is, so I will make a request for the work session that we get, if we could have some information about what's called the GDPR, which would oversee the residents who are in EU member states. And so if these folks are in those countries that we're talking about in regards to LD6, but certainly would have an impact in this case as well. If they deal with EU residents, then they have to comply with those requirements. And so just another thing for the work session that for Ms. McCarthy-Reed, s'il vous plaît.
Okay. I think that Ms. McCarthy-Reed got that loud and clear. And are there any other questions from the committee for Mr. Sultan? Seeing none, thank you, Mr. Sultan, for your testimony. And
thank you.
Now I'm turning to Ms. Pelletreau again from the Maine Association of Health Plans, who's also testifying neither for nor against. Ms. Pelletreau. Welcome.
Here we go. Okay. Thank you for the opportunity to speak. Representative Tepler, members of the committee, my name is Catherine Pelletreau. I'm here today to testify on behalf of the Maine Association of Health Plans. Just a reminder of who the association is. We have 5 members. It's Anthem Blue Cross and Blue Shield, Aetna CVS Health, Community Health Options, Harvard Pilgrim Healthcare, and Cigna. And collectively, our members provide or administer health insurance coverage to over 600,000 Maine people. My comments will be similar to those you've heard before, but I just wanted to emphasize a few points. You've heard the history of this bill. It's been being worked for years. And frankly, very intensively last year. The Bureau of Insurance pulled together a fairly large group of interested parties, and that was here in Maine. And of course, around the country, this bill has been working its way through various legislatures. And interested parties have been invited to participate right along. So I just want to acknowledge that this is, it might be too much to say a cooperative effort, but it certainly has been collaborative. And we want to thank the Bureau for their tremendous listening and for making the changes that they've made to the bill so far. That said, we still have some members in our association who've asked me to raise 2 points. And the first is what Bruce Garrity is calling a materiality clause, what we have talked about as a harm trigger, but it's the concept of setting a standard that doesn't require licensed entities to over-report, where they are required to provide notice to the superintendent when there's, the possibility of harm, of material harm to their customers. That's the first. And the second, and it's interesting to have heard today some of the discussion about privacy, because the second piece really is to protect the confidentiality even more tightly than the language in the bill suggests now. Our members see a gap, particularly where vendors are concerned, either working on behalf of the NAIC or the Bureau and the superintendent. So we've suggested some language that would specifically address that gap and would ensure that confidential information is even more tightly protected in those cases. You've heard that 11 states have passed some version of this bill. Only one, South Carolina, passed the kind of pure original version of the NAIC bill. Every other state that has worked this has adopted many, if not all, of the changes in the industry proposal. So again, I mean, we wish to extend our thanks to the Bureau for their work thus far and appreciate their willingness to listen and look at these 2 points once again. And we thank the committee for the opportunity to speak before you today. Thank you.
Thank you, Ms. Peltro. Questions for Ms. Peltro? Representative Evans, please proceed.
Thank you, Madam Chair. Mrs. Peltro, I just want to go back to the concern about over-reporting. Do you have any numbers or any estimates that may be of a concern with over-reporting? Because I don't know that we have any information in that regard.
I'm happy to take that question back to our members and ask for something more specific for you. But I think Bruce made a nice analogy of, any hacker or any attempt to break into a system that is stopped at, say, the first firewall and never gets to the next firewall, so never poses a threat to personal information held within the licensed entity, or in this, the health insurance plan. Not sure that should require reporting. And you're reporting on something that, has no impact really on our customers. It has extremely little impact on the business, other than perhaps they look at that and try to beef up their, the first firewall to hold out even more.
Ms. Peltro.
Well, I think that.
Go ahead.
Madam Chair, may I follow up? Yeah, that's the hypothetical, and I understand that has been a hypothetical, but you also have to take into consideration that that one hacker may not just stop there. You think that it's something that's not reportable, and you find out later on that it involves the same hacker. So I think that there's some underlying questions that still have to be answered.
Thank you, Dr. Evans. And I think, Ms. Peltro, what Dr. Evans, Representative Evans, sorry, we need to call him Representative Evans, is saying is that we'd love it if you have some data to bring it to the work session, because what we're hearing is, as Dr. Evans, Representative Evans called it, is hypotheticals and concerns about how much you might be required to report, not actual information about how extreme that is.
Thank you for the question. I think I understand.
Thank you.
Thank you.
Thank you. I am turning to Representative Matheson. Please go ahead.
Thank you, Madam Chair, and thank you so much, Catherine, for your information. I keep hearing this term harm trigger, and I guess my question is, are you asking the committee to have the licensees and the agents determine what that harm trigger is? I guess I'm not quite sure. That's what it sounds like from what I'm hearing from all this testimony, is that I completely understand, being a small owner of a small private practice, that over-reporting can be very challenging and paperwork can be very challenging, but I'm not so sure I understand what you mean by that harm trigger and where that definition lies.
I think it's an excellent question. And I don't have a solid answer for that today. I think that's one of the things to work through. I can see, well, I would refer that question to the Bureau about what the existing law is and where the responsibility lies. And I would say for our comment today that, we think there should be a standard that defines the materiality or a harm trigger, as opposed to having to report everything, even if it has no impact on our customers.
Thank you.
Thank you.
Thank you, Ms. Peltro. I also have two questions, and seeing none other from other members of the committee, now I'm going to proceed with my questions. One is there any current system other than what this bill represents for various entities holding this information under the Bureau of Insurance to share information about how many times they've been hacked, how many attempts there have been, who is making those attempts? Because I do feel that's important information. I'm wondering if there's any other system besides the one proposed in this bill for sharing that information.
I'll have to take that back, but it's an interesting question.
Thank you. And then my other question is the question that you raised about vendors. And I need to understand exactly whom you're referring to. For I believe you're referring to vendors who work for the Bureau of Insurance, and it's unclear to me how that relationship is affected in this bill.
Yeah, I mean, we're suggesting adding some language to 2268 in the confidentiality section, and I've given you the language in the written testimony. I don't know how easy that is to pull up, but it adds some more specificity and tightens up the language. So it says that any of the materials or documents in the possession or control of NAIC or a third party consultant or vendor shall be confidential by law and privileged, not be subject to an open records law, or in this state, it would be a Freedom of Information Access Law, FOA, and shall not be subject to subpoena, and shall not be subject to discovery or admissible in evidence
in any private civil action. So in other words, the health plans are taking their responsibility around the confidential information that they hold, on their members and, on their business practice, and saying that should remain confidential and it should be more strictly protected.
So you're creating the possibility of your liability for the revealing of information in this process?
That is a concern. That's a piece of this.
That's interesting. Okay, thank you. Yes, because I think individuals who are the victims of some of these situations that we're concerned about may not want to have their ability to have liability concerns eliminated. Well, I do understand the concerns of the insurers to have those concerns eliminated. So any other questions from the committee for Ms. Peltro? Seeing none, thank you very much for your testimony. Does the committee have any other questions that we can have answered by Ms. McCarthy-Reed or by the Bureau before the work session on this bill? My question for the committee is, do we feel that the request that was made by Mr. Sultan to have further discussions, should we ask the Bureau if they're interested in continuing such discussions, given that they already had a number of open public processes, or not public, but interested parties processes on this bill? Any comments from the committee on that? Well, I think if no one has any specific opinions on that, I'm going to leave that up to the Bureau then, and whether or not they'd like to continue any of these conversations before the work session. Okay, so that brings to an end our morning public hearings on LD 5, 6, and 51. We will be back for a afternoon session at 1:30. So we have only half an hour to catch our lunch and get back on. I'm sorry about that, but testimony went a little long this morning. Maybe we'll use our timer a little bit more. I also would like to remind the committee that tomorrow at 10 a.m. we have an invitation to sit with the Appropriations and Financial Affairs Committee to discuss a small section of the supplemental budget that affects our committee. And I believe that Ms. McCarthy-Reed, I don't know if I've seen it yet, but was sending out some information about that section.
I did email that out to you all Friday, I think, but I can forward it again. So it'll be at the top of your email.
That would be great, since as if anyone else is like me, the amount of email, particularly with
there's a lot.
This bill,
there's a lot, yeah,
has gotten out of hand. Okay. All right. Well, thank you. And just remember, when you jump back on half an hour, our streaming is continuing, so you're immediately visible to the public when you get back on. And just keep that in mind for decorum purposes. So have a good lunch, and I'll see everybody in about half an hour. Hey guys, I want to let you know, I think Heather's going to lead the meeting. At least that was the last text we had.
Okay. Welcome back, everyone, as we reassemble here. Just a reminder that we are still streaming live on YouTube, so mind your mute button, if you would. I'm going to give folks some minutes to assemble. Okay. Still got folks trickling in on the committee, and we'll give it another minute or so. If I could just remind our committee members to mute their microphones unless they're speaking, that'd be great. Thanks. All right. So we are gathered this afternoon to hear a presentation of the report of the Foreign Trained Health Professional Licensing Pilot Project. We're going to hear from Sally Sutton of the New Mainers Resource Center. And I think Vanessa Sylvester may be here as well to assist in the presentation. So Christian, if you'd like to bring them, both of them into our meeting as panelists, we'll give you a minute. All right, great. Wonderful. Welcome, Ms. Sutton and Ms. Sylvester. And I think Colleen is going to be doing some screen sharing for you so that you can share your report with us. And if committee members have questions, please use the raised hand function. I'll see that even while we're screen sharing if you use that function, and then I will call on you as is our usual practice. So with that, Ms. Sutton, please take it away.
Okay, thank you very much, Senator Sanborn. I don't see if, and Representative Tepler and members of the Health Coverage Insurance and Financial Services Committee. We appreciate having the time to present our report to you today. Colleen, if you want to start that would be great. My name is Sally Sutton. I'm the program coordinator of the New Mainers Resource Center, which is a program that the Maine legislature actually set up in 2013 as a pilot project at Portland Adult Education to address the needs of skilled foreign trained professionals as they were coming into the state. So we've had 7 or so years of experience working with New Mainers. For those of you who aren't familiar.
Oh, excuse me, hold on one second.
Okay.
I just want to make sure I can get the document up. I don't want you to go too far along. Sally, without me getting it up here. So
I'm still just on the front page, so that's okay.
good. There we go. I just didn't want to get, I just want to make sure I got the technology going. There we go.
Okay. All right.
Can everybody see that now?
And you can go to the next page there, Colleen. Nope, back one.
Back one. Okay. I went too far. There we go.
There we are. Okay. So as I said, we were a pilot project set up by the Maine legislature in 2013 at Portland Adult Education as part of a larger workforce and economic development initiative that the legislature had passed. The funding for our current project, which is research that we did that developed this report, came from the Maine Health Access Foundation, whose interest was primarily in looking at issues around a cultural diverse and competent workforce. I just want to clarify that they are not at all interested in supporting any legislative proposals. And again, their support just funded the research that we did for this project. For those of you who aren't interested, aren't familiar with Portland Adult Education, it's the state's largest adult education program. We have roughly 2,200 or so new Mainer students coming through when we have physical doors for people to come through doors every year for classes. We teach ESL classes. We have high school diploma courses. We have college transitions, helping people who are interested in moving on to college. And we have what are considered workforce training programs like CNA, providing computer training, accounting, and whatever. And as I mentioned, my program is primarily focused on foreign trained professionals who have degrees or experience from their home country. I've worked with roughly 300 to 400 people each year, and I would say that about 75% of those people have a bachelor's degree or higher. And of the people that I work, 90% have some college or more. Colleen, you can go to the next slide. So the purpose of the project behind the report that you're looking at is for us to look at how to increase diversity and cultural competence in the health workforce. And what we wanted to try to do was identify strategies to reduce barriers. And as I mentioned, we have had the ability to work with several hundred new Mainers each year. So we've learned through all of their efforts in trying to move ahead with their careers. So the purpose is to help, if we can implement these recommendations, will help foreign trained healthcare workers who are here in Maine work towards their highest potential. We will help the state address its goals of a diversified and culturally competent workforce. We can help employers meet their needs for and address workforce shortages. And also, if Maine can do this right, we can help attract more healthcare workers to the state of Maine. Next slide, please. Across the country, there are between 200,000 and 300,000 healthcare professionals with 4-year degrees or higher who are not working at their highest potential. They're working in jobs that require no more than a high school diploma, or they're out of work. And the barriers that most have to face are generally too challenging to overcome. Next slide, please. I think in Maine, we're all familiar with the nursing shortage that's looming before us as one big example, as an area that the state needs to pay some attention to. Next slide, please. We've also seen with the pandemic, unfortunately, the disparity between minority populations and their access to healthcare. And I think as we get in trying to both test people and provide vaccines to people, that the pandemic continues to point out greater disparities in that area. Next slide, please. Fortunately, I think Maine has been paying some attention to this issue over the past few years. As I mentioned, The legislature set up our program at the Portland Adult Ed in 2013. In 2018, we actually did a report somewhat similar to the one that we're discussing now, where we looked more broadly at the issues of faced by foreign trained professionals and their efforts to get back into their professions. And even though the report you have before you today is focused primarily on healthcare professionals, many of the issues cut across all the different sectors. And when we did that report before, we also produced a number of licensing guides. One thing I found that as I worked with people, there really isn't a lot of good, clear information to them on how they need to move forward with their careers for licensing. If you're a doctor or a nurse or an engineer or a teacher. And so we put together these licensing guides that spelled those steps out for people, and also for those who weren't able to move forward with their careers, what would be some options that they might have. In 2019, the legislature passed a bill for Commissioner Ann Head to run a working group to look at barriers around credentialing. In 2019, legislation was passed to set up a loan program through FAME that might help cover the cost for some people for some workforce-related expenses. In 2020, there was work done through the Governor's Office of Policy, Innovation, and Future with a report presented to state officials. Next slide, please. As we did our work, our goals were to remove the barriers for expanding access, and we looked at 3 specific professions. We picked doctors, nurses, and pharmacists because that seemed to be where we had the greatest numbers of people. We've also seen one challenge that many of those people have had is there aren't a lot of mid-level professional health positions for them. People can get in and get started in careers such as CNA or phlebotomist, but they really have a hard time moving up beyond that. We wanted to look at ways to remove overall barriers to licensing. And we also, during this past year or so, we continued to provide advice and case management and support for people. So the process that we went through for our report, or the research we did, we surveyed people, we held meetings, we had interviews with many of the health professionals that we work with. And we also have years of experience working with hundreds of new Mainers. And so we understand, well, this pharmacist wasn't able to move ahead in this way, or this was a barrier for someone else. So we had all of that experience to work with. We also gained input from employers and colleges and universities and the licensing boards and other stakeholders. And we also have the advantage of being part of a national group called the Welcome Back Initiative, which is 9 or 10 programs around the country that, for the most part, do the same work that we do here, working with health professionals. Some serve broader audiences. The program in Boston just serves nurses. So again, we've had the ability to learn from the work that many of these other programs have done over the years. Next slide, please. What we found, generally, these are the major barriers that we saw. And unfortunately, for the most part, people are not able to be licensed in Maine in their previous profession. Most are unable to work on any of the licensing issues that they have to deal with, which might include taking some classes, working on English, preparing for tests, paying high application fees, because they have to deal with just meeting their basic needs. In Maine, the population that we have here, people are primarily coming as refugees and asylum seekers. And so for the most part, when they get here, they're starting their lives all over again. They have to start jobs, find the first job that they can to just meet their family's needs. They might still have families back in their home countries that they also have to worry about supporting. So it's quite a balancing act for someone to work and support their family and either take classes or work towards licensing things. So just meeting basic needs is a big problem. And one of the other things we've seen for the people that we have worked with is they don't have access to a lot of resources to help pay for some of the expenses related to going back to school or related to licensing. What we've also seen is that colleges and universities don't offer a lot of meaningful advanced standing for someone who might have a previous degree. And so many people have to start their educations all over, and they don't qualify for federal financial aid. If you already have a degree from another country, you don't qualify for federal financial aid. Or if you're an asylum seeker, until you have permanent status, you also are not eligible for financial aid. English proficiency is a challenge at many different levels. For people who are just getting here, they might have to work on their English before they're ready to start taking classes or start some of the licensing process. And then even for people who have been here for many years, who may be studying now to take the test to become licensed as a doctor or the test to become licensed as a pharmacist. Those, you both have to have very high English. You also have to really know your subject matter, and they're timed tests. And so for anyone who doesn't have English as their first language, time tests are always a real significant challenge. So again, people need help with English proficiency at all different levels. There's not a lot of good, accurate information about a licensing process that someone might have to go through and what their options are. And so that's been a big challenge for many people. For the benefits that might exist for people, and many employers offer employer assistance programs, but they don't necessarily meet the needs of someone who, again, I'll pick someone who's studying to become a licensed physician here, is if you look at how much time it would take someone to put into preparing for the tests that they need to take, they probably should be studying for full-time for a year or 2 years to prepare for those tests. And to put that time in while you're also working, it doesn't work out for many people. So it's just the employee assistance programs generally are not matched up to meet the people who are moving forward with licensing. People's immigration status can also interfere with their ability to access workforce programs. For people who are here as asylum seekers, many of them have a long period of time before they are able to work, and that's a really good time to get training, make training available to them. But many of our programs in the state, you're not eligible for until you have your work authorization. Also, for some people who are here, again, as asylum seekers, and that process now for some people can drag on to 10 or 12 or more years, unfortunately. If someone's a physician and they're here as an asylum seeker, one big step that they need to be able to take is to be accepted into a residency program. And residency programs are very rare and difficult to get into to begin with. But also, if a person can't guarantee that they're going to be here permanently, then the residency programs won't accept them into a program. And then also mid-level healthcare positions, there aren't a lot of them, and that could be a good way to get people to be able to use more of their scope of work, but it's just those options don't generally exist too much in Maine without having someone to start at the beginning and retrain for something. Next slide, please. So we have a number of recommendations that cut across a lot of different sectors, and I'll just get into those in the next slide. So for colleges, as I mentioned before, if they can look at their programs and think about offering advanced standing for people or providing some more flexibility about how they look at evaluating someone's degree from another country. One example that we think might be a good option for some of the people we work with is if Maine could come up with a program that was a foreign doctor to RN associate degree and put that on a fast track, that would be one example of a way to move people through quickly and into a program, into a profession where they can put more of their skills to work. Employers can look at the tuition plans that they offer and look to see how they might invest more in the employees that they already have and provide more internships. Licensing is a big issue, and there's a piece of legislation, LD 149, which is based on the work that the Commissioner Head's working group did last year or so, and that, as well as some other proposals, are coming through. And then the state can also look at the language that it has around some of the programs that it offers, such as the Competitive Skills Scholarship Program, or FAME might be able to modify some of the language that they have around their workforce programs or loan programs to better meet the needs of this population. And with our own program at Portland Adult Education, one of the things we'd like to try to be able to do is sort of, because we've been able to develop the expertise here, I think what we'd like to do is be able to expand our programming so that we are able to offer higher level English classes or resources designed specifically for people who are going towards licensing or need help with test prep or whatever. So these are where, in our report, these are generally where the recommendations fall. Next slide, please. So I did mention this one bill that's coming forward, LD 149, which is based on the working group. And then there are a couple other bills that will be before your committee. LD 31, this Occupational Therapist Compact Act. I put that in as an example of something that your committee should think about as you're considering that bill. I've tried to dive into what that compact includes, but I think it's an example where if Maine as a state can try and figure out how to maintain more control over decisions around who becomes licensed, that will allow more flexibility and the local boards to be able to make more decisions where we see some challenges for many people. And again, I don't know if it's true in this Compact Act or not, but to the extent that decisions are made at a national level by a national group of licensing boards or whatever, and states don't have the ability to move away from those procedures, that takes away control that you might have. Some of those areas, they might set up stricter policies around how degrees are evaluated or where they come from or whatever. So again, this Compact Act might just be an example of, as pieces of legislation come before you, make sure you look at it with an eye towards, will this make it easier for foreign trained professionals to be licensed in Maine, or will it set up barriers that they will not be able to overcome? And LD4, which will be before you, is opening up the Maine Pharmacy Act to allow the board to set up a process by which foreign trained pharmacists could be considered for licensing here without going through the process that currently exists. Next slide. Some of other things to think about, as I mentioned, Finance Authority of Maine has things like the Doctors for Maine Futures and Maine Health Professionals Loan Program. So if those can be adapted to meet the needs of foreign trained health professionals, that would open up more resources for them. The legislation that set up the OPAR working group was good, but there are also a lot of licensing boards and bodies that exist outside of that. So legislation that might, or recommendations to all these different licensing bodies, that they themselves do a review of their practices and policies and procedures to try and remove barriers. And for many of these, it could just be making the information on their website more easily accessible. It's very difficult to find for most professions, and in some cases you have to dig actually into the rules to figure out what you need to do. Whereas if there could be consistent and clear information on the different board websites, that would make it a lot easier. And then certainly if we could have more resources to expand what we're trying to do, we're trying to, again, build on the expertise that we have and help different service providers and individuals around the state as they are starting to deal with this, with new Mainers as they move out to other communities. Next slide. I think, I've already discussed this. We can go to the next one. So again, what we want to try and do with the recommendations that we've presented is help foreign trained healthcare workers reach their highest potential, help the state address its goal of a diversified and culturally competent workforce. We want to help health employers meet their needs to address the state's workforce shortages. And again, if Maine can do this right, we can attract more people to the state. Next slide. I think I've discussed all of these, and we can just go to the final slide, and then I'll ask Vanessa if she wants to add anything.
Thanks, Sally. I think that's pretty comprehensive. I think just like the, final thoughts on this in doing this work, it's our thought that we should be able to figure this out. We have severe and upcoming shortages, particularly in primary care. And we've got a lot of people here that are highly skilled providers, physicians, nurses that are just not able to practice in the state of Maine. So we think there's a solution to this. And I'd like to hear your feedback and take any questions.
Thanks so much for the presentation. Are there questions from the committee for our presenters? Representative Tepler.
Thank you, Madam Chair. And just want to say that I believe this is a huge workforce issue for the state of Maine. And having served on Commissioner Head's working group, we heard from a lot of people about the issues and problems. And my bill was one of the two that was squished in to create that working group. But I think that, with all the concerns that we have about healthcare workers, and we've seen the issue of the shortages grow as the pandemic has grown as well, that we are really wasting some incredible talent that's here. And that I hope that we will be able to find some ways to get folks who have talent to a place where they can work and help us get through various health crises. Isn't that so?
Thanks, Representative Tepler. Are there other committee members with questions? I will ask one. Not seeing any other hands at the moment. My question is about licensure compacts, and that was a piece that I hadn't heard concern about or thought of previously, because certainly part of the point of licensure compacts is to make it easier for folks who've been trained in other states to be able to deploy their talents in Maine, which is also a goal, right? When we think of foreign born, perhaps we might think of both out-of-state folks that we want to have moved to Maine, as well as other out-of-country folks who we want to have bring their talents to Maine. And so I guess I'd love a little bit more elaboration on what you folks have found, either of you, with regard to licensure compacts in the healthcare field, and whether we need to avoid them entirely because they don't deal well with foreign-born credentialed individuals, or whether there's some way to thread this needle so we can attract folks from other states as well.
I'll turn it to Vanessa in a second. And again, I haven't really had a chance to look at the occupational therapist one. And in addition to allowing more US trained people from other states to come here, foreign trained professionals who can be licensed in another state, which has an easier process, and may also open up the doors for them. I'm just throwing it out as, again, making sure almost anytime you look at any piece of legislation, does it make it easier or does it make it harder? Just to have that lens as you look at these compacts. And again, there are some where people get into difficulty is generally around the documentation of their degrees. And what we see is many of these organizations, which, and I'll look at nursing, which uses CGFNS in Maine, and there are other professions where you have to go through whatever the evaluation company is that this national group of collection of boards determines is how you have to do it. And again, for many of the people who we are working with, again, who are coming here as asylum seekers or refugees, they didn't have an opportunity to plan their lives out. They weren't planning to come to the US to work in whatever their health profession is. So their ability to access their documents is very different than someone who is back in their country planning to be here and can go to their school and get everything that they need. And so again, some of these national entities set requirements on how an evaluation can be done and what is the entity that can do it. And if that evaluation company only requires that documents be sent from someone's home school, well, if you went to school in Iraq and your school has been bombed and doesn't exist anymore, then you're not going to be able to be licensed here. So again, all we're suggesting is as you look at these compacts, do they make it easier or do they make it harder? And I think one thing in Commissioner Head's bill is she's trying to build in more flexibility around the evaluation companies that are being allowed for the different licensing boards to build. So that's my framework on it. Vanessa, I don't know if you want to add anything to that.
Yeah, I think the only thing on compacts, and Sally, that's exactly right, is anytime you see something with a compact for this particular issue, you want to examine it. Generally, compacts are going to do two things. They're going to expand access between the states, and there's an openness there. The flip side of a compact for anything is that it may take away some of the state's authority and flexibility to be part of the compact. But each one of the compact agreements generally has some menus, right? So of which you can pick and choose. And a lot of our, the state's licensures, there is discretion on many of these things. And you're going to see that in the engineering licensing has a bill that will have some discretion for documentation, residency type things. And that's what you want to make sure, not just for this issue, that you pay attention to that as far as the overall compacts go. And I just add, if I may, on one of the recommendations that we were looked at for this particular committee is that'd be very useful to have a deep and specific review of these policies for the Board of Nursing and the Board of Medicine, which is not necessarily affiliated with it, not part of OPOR, but affiliated with it, to have that kind of review, because that's where we're seeing a lot of physicians, and then a lot of physicians are looking at particularly, can we work as nurses? So, and that fell outside of the report.
Okay, great. Representative Arford.
Yes, thank you, Madam Chair, and thank you, Ms. Sutton and Sylvester, for coming and being with us today. I have a great deal of respect for the work you do, and I truly understand the need for it. I just have a couple of questions about the extent of the program and the programs that you would like to offer or have offered. I think we all are aware of the fact that there's programs for domestic people who are not coming from another country, but have been raised here or live currently in our state, that targets certain parts of the state that are in greater need of healthcare professionals. And people are provided with services and support in exchange for a willingness to practice in those specific areas. And they get support for doing that as well. And I'm wondering if there's any component of your program that looks at doing that as well.
I would say that certainly is an option to explore, but I think the other piece you have to understand is people will do better generally if they can be part of a community. And to pick someone up who's either living in Portland or Lewiston and put them in a city where there may not be very many other people of color, there may not be an immigrant community that they can be part of, maybe we can address, the training or the workforce to get them to that employer. But I think there also have to be issues around what are the other supports that particular community might need to have in place to make someone feel welcome there. And then again, and maybe, figure out, if someone is coming with their family, what do the schools have to offer? Are there ESL programs there? Or if there's a spouse, which is a big issue for a lot of professions, what are those other opportunities? So I think that there are certainly those options. And as we work with people, we see our work as being trying to help address statewide issues. And I think being able to figure out exactly what you're asking about might help people feel more comfortable moving to other states. And it might start out a little bit slowly. Well, all right, now here's Augusta, now here's Bangor. And in some of those communities, they are developing welcoming centers or programs for immigrants. And so, those certainly would be ones where it would be worth starting to look at in terms of how to get people to those areas.
And then just real quickly, the only other thing I was wondering about was in terms of any exams that any of these members of these people might, need to take to qualify to practice in any number of healthcare professions. Is it ever possible for them to get assistance, not with answering the exam, but with taking it, like do things, parts of it in their own language or whatever, so that they could be more successful at actually passing credentialing exams?
And that's one of the goals. And if I had a chance to spend more time about what we're looking at trying to build out at our program at Portland Adult Education, and I can think of it best as a physical building. Like our building is in an old Catholic school, and we have 2 floors. And I picture our programming being a 3rd floor that gets built on top of that, where if you're a physician and you have to learn to take, they're called USMLE tests, what are the prep courses that person needs for those tests? So we're not just teaching English and helping and connecting people to those resources. We are giving them test taking skills. And so the challenge that Maine has, that I've seen how we're different from some of the other programs in other states, is they have lots of people. Like they can put on a nursing program that will fit 20 people. And we're actually trying to figure out how to get some of our people into some of their courses now that more things are remote. So it won't help us to say, well, let's offer this particular class when we might only have 1 or 2 people who need it at that point. So that's why I'm thinking more of like a resource center where we know, all right, if you're a doctor, here are the tests that you need to take, and these are the prep materials that you need to have. One of the other professions that we had an opportunity to work a little bit more deeply with was pharmacists. We have some pharmacists that are going towards licensure. We have some that have gone back to school, but in working with those, and there aren't a lot of them, I think, at this point we have 3 or 4 who are ready to move on either to licensure or school. But I worked with them to figure out what are the prep resources that they needed to take their test. And so if we can have access to those, then these things cost a lot of money. If you've gone through a US medical school and you're now taking these same tests that our people are having to take, they can be spending $5,000 to $10,000 more to be prepared to take that test. So I'm looking for a way that we actually know what those resources are to help people be ready for that test and prepare for it, and also the financial supports to access it. And we've been fortunate in our program to have access to some foundation support to help pay for things. But a lot of the workforce, and this is some of our recommendations, a lot of the workforce dollars we have don't reach to this level of, or this type of expense that people have. We have CSSP program, which is great for a lot of things, competitive skills scholarship program, but they only help people through certain degrees. They don't help people, oh, you want to be a doctor or you want to be this nurse or pharmacist. They don't necessarily go up to that level of materials or supports that someone needs to be successful in those professions. And that's what we want to pull together in our program is, all right, so we have these 3 people who need this, all right, you take this test or we'll do this, or again, so that's what we want to pull together.
Thank you very much.
Sort of like colleges have resource centers for their students. If you need help writing a paper or studying for an exam or a tutor or something, that's what I envision us trying to pull together.
Thank you, Ms. Sutton. Representative Brooks.
Yes, I really appreciate the work that we're doing in this area. It's really critical that we utilize new Mainers' skills from their entire background. I think it is important to help pull in help from basic needs to make. I think saying that basic needs need to be addressed, and that could be a big barrier. So I think the work you're doing is great, and I would like to see a more continued work in addressing these barriers and recognizing the tremendous talent we have.
Thank you, Representative Brooks. Senator Brenner.
Thank you both so much. I'm excited to hear what you have to say. I have a handful of questions. My first is, could you offer any feedback about other states that are getting this right, particularly for the nursing track?
I think I haven't really seen nurses be successful going through licensing here in Maine. And some of that may be how people are coming to us. Again, if you're a refugee or an asylum seeker, you don't have all those documents that if you've worked with an agency back in your home country, which some countries and states do this, they help you with all of that, pull that together, pass your English test or whatever. The other thing to think about is if I looked at where many of the nurses who are coming here from, many of them are coming from that, again, that we work with are coming from African countries, and the nursing profession in those countries, the schooling that they have doesn't necessarily line up with the schooling that is required here. So it's hard to find people who have that bachelor's in nursing that's necessary for moving forward. And the licensing body that the state uses, CGFNS, is a big challenge to get through. And again, we don't have a lot of experience with it, but working with these other welcome back programs around the country, what I hear from them is if you can figure out an option other than CGFNS, it will help more people go through. Again, I think we should, it's such a complicated process. I think it certainly would help to, again, as Vanessa had said earlier, work with that nursing licensing board and figure out what are the specific barriers that people are encountering and trying to address those.
Thank you, Ms. Sutton. I think the question that Senator Brenner asked was whether there were any other states that had done it really well.
Other states deal with different populations than ours, and so they might be, working with that particular population. So I can't really say that. We usually turn to Massachusetts program, which just focuses on nursing. Vanessa, I don't know if you want to add anything to it.
Yeah, and on that particular question, there's a couple states that are doing a few things. So Colorado, for instance, their Board of Nursing, instead of just having one credentialing like we do, most states do, like Sally was talking about, they have now opened up their credentialing review to about 3 or 4. And that is very recent. It's within the year. So far, that seems to be very successful. So that would be something to look at to do. California, for nursing in particular, they do not require the English portion of it when they're going through their licensing. So they leave that up to the employers to decide the level of English. So that's removed from that licensing process in California right now. The other thing that exists in some other states, which we're looking at, and that's part of our recommendation, is a direct entry program for doctors into a nursing program or a nurse practitioner. That's very, very important if a lot of doctors would like to maintain that same level of practice, which could a nurse practitioner would offer, and they have to start from scratch. So I would say those are some examples of success. Colorado, they've just opened it up, their nursing board. California has gotten rid of the English requirement, and the moving to direct entry programs into higher level of nursing are some key things. And we can get you more information on those particular programs.
Senator Brenner, do you have additional questions?
I had one other one. In your thinking about all this, were you able to find any countries where folks are immigrating or seeking asylum from where there was a comparable educational track that that we could look at for certification? Like, I'm wondering, if you could say if someone's coming from these 5 countries with this degree, we could most likely assume that the standard of education and licensure is similar to what we would like to see in Maine. Is there anything like that?
Again, from the countries that we work with, there are people coming through with nursing licenses. It's just but there are different schools within different country within a country. So, but we have seen people with bachelor's degrees coming in, and some of them have tried for licensing and would qualify to go forward. There are, for them, a lot of the time, the issue is with getting the documents from their country sent to CGFNS, and that's even more of a problem now with everything under lockdown. The other issue that we see for some people who actually choose to go back and get a nursing degree here is probably at the associate degree level, maybe they can get credit for some of their courses, but generally at the bachelor's degree level, they're not getting credit for anything that they've taken, and they essentially have to start all over again.
Mm-hmm. And if it's okay, Madam Chair, I have one additional question. I'm wondering if you were able to receive any feedback from either of the two large hospital systems, Northern Lights and Maine Health, about the sort of temperature in the room in those organizations to fund any of this talent development.
Right now, we're going through a process where, as we're sharing our report with you, we're also sharing it with them. And we have different initiatives happening within each of those. What we are mostly seeing with Mercy Hospital, which is the Northern Lights version of in Portland, and Maine Health, is they're looking at a lot of their people who come in as environmental service workers and trying to figure out programs to get them promoted into either medical assistant or like a patient services office kind of rep. And so we're working with them on developing those programs. I think where the challenge is, and again, and that takes a lot of work, and that's a really good partnership. I think where it's harder is where you have people who have these advanced degrees who need something that's a little bit different, and the investment that it would take to put into one of those people. I mean, right now we've got a pharmacist that we've worked with extensively, and also a doctor, both at Maine Health now. And they each could use time off to study for their exams. They each could use another few $1,000s to pay for prep courses and other things. One person could use an observership. And so some of our recommendations are geared towards employers where we say, you have these good employees, here's what you can do if you want to help them move up their career path. And for some of them, it will take an investment in their own people and their workers. But they're at the table, we're talking to them. It's just, this is so big. And there are a lot of moving parts with it. Vanessa, I don't know if you wanted to add anything to that.
Representative Tepler.
Thank you. I hope it's all right if I add to that just a little bit, Ms. Sutton. In my experience, a number of people from Africa, in particular from different countries in Africa, were trained in countries outside of Africa. So just because you could say, let's say that medical training in Uganda was good enough, that doesn't mean that a doctor coming here from Uganda was trained in Uganda. That doctor might have been trained in the former Soviet Union or in France or in Belgium. So it's difficult, I think, to make that kind of blanket statement about people coming from certain countries and their training being acceptable or not acceptable. I think that it's more going to have to be, to some extent, on an individual case-by-case basis, and also helping people more broadly in not making silly requirements. For example, if you have a PhD, you shouldn't have to present your high school diploma in order to be licensed. And I know from looking at some of the licensure requirements that a high school diploma is part of the licensure requirement. So that's the kind of thing I think that Ms. Sylvester and Ms. Sutton are working on, and trying to help foreign trained professionals, particularly in healthcare, find their way into our system so they can be treating Maine people.
If I could add something to what Representative Tepler said, and again, this gets back to people coming here as refugees or asylum seekers, and looking at what the challenges are for people who want to be licensed here again as a doctor. Getting into a residency program, which is at the end of the process of the application for a physician, is very competitive. And the competition is around how many years since you graduated from medical school. And If it's been more than 5 years since you've graduated, you essentially are not competitive to apply for any residency programs. And if you come here and you're having to spend a few years establishing yourself and making money and working on your English a few years, the more years you're out from graduating from medical school, the less competitive you are. But what we see is those people, it's not that they've just been sitting on their hands doing nothing. They've been out practicing medicine and they're given no credit for that. And so again, that's one reason why we focused on physicians in our work, is there is such experience there that if we can find another way to, if they can't be licensed as a physician, is there some other way to get them into a position which may not exist yet that takes more advantage of their scope of work than just being a CNA or medical assistant?
Representative Evans.
Thank you, Madam Chair. I just wanted to follow up. You have to understand first that residency, the slots for residency training, those are determined by Congress. And so those slots are very few in number. The second thing is that anyone who is foreign trained as a physician, you can still, the place to start is with, if you're going to go to California, you want to find out what their rules are and what their regulations are through their Board of Medicine. Same thing here in Maine. You will have to, and if you don't have all of your documentations and that's presented, there are other alternative ways to get information as to whether or not you are actually trained. But whether or not that occurs, you still will be required to pass one of the national examinations for licensure. It's going to be either the flex exam or the National Board of Medicine examination. You have to pass that before you can even consider residency training. Now, what some people do is that they partner with another physician who is already trained and licensed in the States, and get the experience that they need in order for them to apply at a later time for their license. So that time is not idly wasted. And also a lot of people are compensated for that. So I would always direct you first to the State Board of Medicine. And now you also have to consider that there are national boards that also come into play as far as residency training and requirements for licensing and requirements for residency programs. So it's not a one size fits all. At one point in time, there was reciprocity between states for licensure. So if I'm licensed in Maine, and all I have to do is apply to be licensed, say, in Nebraska, based on my license in Maine, Nebraska would give me a license. That has all changed. It's not as simple as that anymore, because you had physicians who get in trouble in one state and then they just move to the next state. So we had to stem that tide. So, but the best thing is to, if someone is attempting to continue training with a career of medicine in mind, there is a step ladder, but you're going to have to go through the certain steps by that state. So,
If I could add something to that, the challenge that many of the physicians were working with is that they are here as asylum seekers. And so they don't yet have permanent status. And so they can take all those tests and do everything to get ready, but there will not be a residency program that will accept them. So we're, in our report, one of the things we're trying to figure out, is there another level or type of position where we can get as much out of their skills and training as possible that doesn't require them to be licensed as a physician. And again, we have more information in our report about that, looking at, are there other potential mid-level health positions that people could go for. One thing we've looked at that has been successful for people that do come with permanent status is trying to become a physician assistant. And we've had a couple people who have successfully gotten into UNE's program. But again, it's still a physician who has many years of experience who essentially has to go back to school and start all over again. And the cost of that and being able to access and borrow money, $100,000 or more for that program, asylum seekers don't have the ability to borrow that money and to get into that type of program.
Representative Evans.
Just to respond, I understand what you're saying, but no matter what your status is, you're not going to get licensed as a physician in the United States. Even people who come from any other country, they may have trained in a residency in general surgery. That may or may not be accepted by the American Board of Surgery. And in most cases, it's not accepted because the level of training is different. The US looks at the level of training as being different from what is required by the United States. In those situations, that person may have to do 2 years of training beyond what they did before they even came to the United States. So the best thing to do is to coordinate with the Board of Licensure in the state. And because there are a lot of interplaying parts to this will. So, and I don't want people to think that you're going to come and you're going to become licensed as a doctor. That has never happened, and it's not going to happen. And
thank you, Dr. Evans. Yeah, no, I want to, we're running out of time in our hour here that we had, Ms. Sutton and Ms. Sylvester, and I think we've lost a little bit of the focus on the report that they presented to us, which was about how we lower the barriers in Maine in order to ensure that we can provide the highest possible professional opportunities for foreign-born professionals. So definitely appreciate your perspective on the sort of broader national context of what exists today for MDs. But you know, I think these guys are trying to figure out some ways to lower some of the barriers to, for example, advanced practice nursing roles, I believe is what I heard, for foreign-born physicians, as a way to better utilize their skills rather than keeping them in a CNA or a medical assistant role, which is a lower skilled nursing role that doesn't utilize their training as well. So I just want to make sure we're on the same page and utilizing our time to the best of our ability. Representative Evans, with that in mind, do you want to continue? Do you have any additional questions for Ms. Sutton or Ms. Sylvester?
No, I don't. I agree with the focus, but I wanted to be clear that there are ways to go about achieving the long-term solution as well. But I understand the focus. Great,
thank you. Ms. Sylvester and Ms. Sutton, do you have any last comments for us as we're at the end of our hour here before we go?
Well, just to respond to Representative Evans quickly, we have developed a licensing guide for physicians that addresses many of the things you've talked about, and I'll be happy to forward that to you so you see how we spell it out. And we appreciate the time with this committee. I hope if you have further discussions or issues that you want to pursue, you'll reach out to us. We're here. Again, this is, I think Maine is much further ahead, given the fact that you are here thinking about this and talking about it, and we appreciate that time. Vanessa?
Thank you all very much.
All right, wonderful. Well, thank you for that presentation. And we really appreciate the emphasis that you folks have placed on it and helping folks navigate these difficult circumstances that they may find themselves in. With that, I'm going to check in with Colleen and with Christian as to whether we have anything else on our docket for this afternoon.
We don't have anything else on the docket. I don't know if you want to hang on and talk scheduling today or hold off until tomorrow at some point. But just a reminder that tomorrow morning, the committee is invited to participate with the Appropriations Committee at 10 a.m. You should already have the links for that, but I will share the link again and also share again the copies of the relevant materials for the supplemental budget hearing. So you'll have it in the top of your email box for the morning session.
Great, that's very helpful. And I did want to just say to Christian that it is very helpful that we get a reminder an hour beforehand. I know the link that I had cut and pasted into my calendar was wrong this morning, but the link at the top of my email was right. So appreciate that that setting, and perhaps you can share it with all the other clerks because it's really helpful. In any case, so with that, Colleen, I think we'll touch base on scheduling tomorrow, as I have another meeting in 4 minutes that I would like to switch over to. Does anyone on the committee have any other comments before we sign off for the afternoon? Representative Tepler.
Sorry, just wanted to say, so scheduling meeting tomorrow?
Yeah.
Okay.
Yeah. Okay. Great. Wonderful. Thanks everybody for being with us today. And with that, we are adjourned. Thank you.